Good morning and welcome to day one of the Board of Registered Nursing Board meeting. Today is May 28th, 2025, and we will begin by taking roll call to establish our quorum. My name is Dolores Trujillo. I was appointed by Governor Newsom to fulfill the direct care provider role, and I am the current president of the board. Vice President Neelu Patel.
Vice President Neelu Patel, good morning, everyone. I am a certified registered nurse anesthetist, and I was appointed by Governor Newsom in the advanced practice role.
Thank you, Neelu. Board Member Allison Cormack.
Good morning. My name is Allison Cormack. I'm a member of the public, and I was appointed by the Speaker of the Assembly.
Thank you, Allison. Board Member Jovita Dominguez.
Good morning, Jovita Dominguez. I'm appointed by Governor Newsom in the education role.
Thank you, Jovita. Board Member Vicki Granowitz.
Vicki Granowitz, I'm a member of the public. I was appointed by the Speaker of the Senate.
Thank
President
you, Vicki.
of the Senate.
Thank you, Vicki. Board Member David Lawler.
Good morning, David Lawler, appointed by Governor Newsom in the public member role.
Thank you, David. And Board Member Tricia Nguyen.
Hi, good morning, everyone. Tricia Nguyen. I was appointed by Governor Newsom in one of the public member roles.
Thank you. Our Board Counsel, Reza Pejuhesh.
Good morning, Reza Pejuhesh, BRN Legal Counsel.
Thank you, Reza. And due to unforeseen circumstances, Lori, our Board Executive Officer, will not be attending the May board meeting this week. She is expected to return to work on or around June 10th, 2025. We have established a quorum. We can move on in the agenda to 2.0. This is a general instructions for a format of a teleconference call. BRN moderator.
Good morning. This is the BRN moderator. I will be moderating the meeting. To facilitate public comment, we will be utilizing the WebEx question and answer feature. When the board reaches a point in the agenda at which public comment is appropriate, the question and answer feature will be turned on, and members of the public can indicate they would like to make a comment by inserting the phrase, "I would like to make a comment," in the question box, which is typically in the lower right of your screen. I will then call on the individual and unmute their microphone. The individual will have 2 minutes to make their comments. I will not give a warning as your time approaches. I will mute your microphone and will announce that your time has exceeded the time allotted. I will then proceed to the next member of the public who has a comment. We will also query our in-person location there in the BRN HQ hearing room. Please note that the question and answer feature is being used only as a means for members of the public to represent that they would like to make a verbal comment. When your turn comes, you will be prompted to unmute. If your question can be answered, the board will respond accordingly. When making your comment, please speak about anything you believe is important for the members to know. Remember, board members cannot address any item not on the agenda. Items not on the agenda at that moment, items that you would like to add to a future meeting, or items that will be discussed later on the agenda will be discussed at the correct times during the meeting. I will provide a brief reminder of this approach at the start of each public comment item. Finally, when board members or BRN staff are not speaking, I would like to remind them to mute their microphone. If I detect background noise during the meeting as a result of unmuted microphones, I will mute your microphone automatically.
Okay, moving on to item 3.0. This is public comments for items not on the agenda and items for future agenda.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Bobby Dalton G. Roy would like to make a comment. 1 second, please.
My name is Bobby Roy. I am the Bargaining Unit 21 Chair for SAIU Local 1000 and we represent the nursing education consultants at your board. And I'm calling to advocate for wage increases for them, 11 of whom currently work for your board, underpaid and overworked, and facing impacts that may befall all state workers in the budget that can be mitigated through actions from the board and the DCA. As a specially funded entity with healthy reserves, and there's an opportunity here to mobilize a larger fraction of these funds to raise the wages and help make sure that their wages are competitive with the market rate and the value that they provide. We're asking the board, the DCA, to do the right thing and invest in the greatest resource that it has, its workforce. NECs are marketable and RNs are in high demand in a time when we have low supply. Recent reports from the Bureau of Labor Statistics show that the unemployment rates for medical care professionals are incredibly low at the moment, and the demand is high, but there's a low supply again. Basic economics tells us that high demand and low supply means high prices, and we can't put a price on our healthcare system. Nurses are the backbone of our healthcare system, and if the state doesn't pay NECs their market value, they won't come, they will leave, and there won't be anyone to provide consultation to new or existing nursing programs, of which we definitely need. How would the public react if the state continued to collect fees for services that they cannot provide in an effective, timely, and safe manner? Not investing in our NECs could be catastrophic for the BRN, the DCA, California, and California's healthcare system. I urge this body to compel and demand that the DCA follow the Department of Human Resources HR Manual Section 1715 to submit an employee compensation request that makes a meaningful attempt at fixing the arduous working conditions that our NECs are in. Now, say that it's too late to do that those were due on May 1st, but I'm sure that CalHR is still accepting these requests if they have not already been submitted. So thank you for your time and have a great day.
Thank you for your comment. Mary Adorno would like to make a comment. 1 second, please. Uh-oh, wait a minute. I lost her. Mary Adorno. Oh, found her. Sorry. Mary, go ahead.
Good morning, members of the BRN board. This is Mary Adorno. I am speaking on behalf of the California Association for Health Services at Home. And I was hoping to get an update on the number of nurse practitioners that are that have met the board's certification requirements to be independent nurse practitioners. I was hoping that could happen during the NP committee update, if they could give us the number, or if there's a place on the website you can go to actually compile those statistics, that would be excellent. I also have a question about the current position of the board on the Nurse Compact Act, if they could comment as to why they are still opposed. I know there was a meeting that discussed some strategic planning with the board to look at alternatives that could happen so that they wouldn't be completely opposing that Nurse Compact Act. Those are the only two areas right now that are not, I don't believe are on the agenda. So I hope I'm not out of line in bringing those up. And I just also wanted to thank the board for their excellent work and for all of the resources that they do have on their website and how you post updates to opinions and other areas that do the Nurse Scope of Practice Act. Thank you so much and have a wonderful day.
Thank you for your comment. Paloma Cerna would like to make a comment. 1 second, please.
I'm the mother of Elisa Serna, who died November 11th, 2019 in Las Colinas Jail in San Diego County. We had a criminal trial last year in January for nurse Dana Lee Pasqua. She was being charged for manslaughter for my daughter's death. A federal judge made videos and documents public, which could be seen on justiceforelisaserna.com, of how Dana Lee Pasqua treated my daughter. She neglected her. She stood over her for minutes, just looking at her, not rendering aid at all. On May 8th of last year, a complaint was filed from your board regarding maybe an investigation. I'm still waiting for an update on that because I do see that she still holds her license. She was found not guilty by the jurors since her and a doctor, Frederic Valenti, were only being charged, and the jurors could not find two individuals guilty for her death when my daughter was in custody for 5 days, and she went through a alcohol withdrawal, and there was multiple people. If you were to look at the videos, you would see that there was multiple people. So it was frustrating that she was not charged for her death, but I understood why. And also too, I'm asking for investigation on the other nurses who were also had contact with my daughter and did nothing. Also, they did not call 911. They were right, instead of, they couldn't not even take simple vitals, a temperature, blood pressure. They're too busy writing on her medical record, her on the self notes. They were calling her a crackhead, a B, drug user, out for secondhand gain, malingering. And so that would be Nurse Alicia Robusta, Nurse Lorraine Roca, Nurse Rovina Isidro, Nurse Hazel Kamama, and the charge nurse Maybell Domingo. These individuals need to.
Thank you for your comment. Board President Trujillo, there are no other public requests for comments on the WebEx. Do we have any in-person requests for comments there in BRN HQ?
No, it doesn't appear we have any requests for comments here at HQ.
Thank you. Would you like me to close this window?
Yes, please. Thank you. At this time, I'm going to take the opportunity to reorder the agenda. Looking at 5.4, so the section 5.4, 5.4.1, and 5.4.2, we will do after 11 o'clock.
This is Reza, Board Counsel. Just wanted to take just a brief moment, circle back to a couple of the public comments, just to not leave those things lingering. Ms. Adorno, I apologize. I was not able to hear, or could hear but couldn't fully understand all of the comments. I heard a question about the board's position on the nurse licensure compact. I couldn't hear it in too much detail, but in case you're not aware, you might already be aware the board has not been in support of joining the compact historically. You can probably find information in past board meeting minutes and things like that about that. The next commenter was speaking about a specific case, Dana Lee Pasqua. I believe the reason the individual still has her license is her hearing is pending, and it looks like there's a hearing scheduled November 4th of this year, November 3rd and 4th, I'm sorry. So until that hearing takes place and due process plays out, we can't simply revoke the license. So that's the status of that one. I just wanted to circle back on those comments, and that's all.
Thank you, Reza. All right, at this time, we're at item 4.0, review and possible action, approval of prior minutes. These are the minutes from February 26th, 27th, 2025, and also March 20th, 2025. I would like to make a motion for accepting the board meeting minutes from February 26, 27, 2025 and March 20th, 2025, and allow BRN staff to make non-substantive changes to correct name misspellings and/or typos that may be discovered in the document.
I'll second that motion.
Thank you, Tricia. BRN,
Chair Trujillo,
yes.
may I just make a notation about the March 20th
Sure.
minutes? On page 19, Board Member Granowitz is noted as voting yes on one of the items, but I believe she was absent that day, and all of the other voting records indicate that she and the other person were not there. So page 19. Thank you.
Any other comments or requests from board members? Seeing that there is none, BRN moderator, can you please open us up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Do we have any in-person requests for comments there in your location in BRN HQ?
There doesn't appear to be any requests for comment here in HQ.
Thank you. Would you like me to close this window?
Yes, please. Thank you.
Thank you.
So we're accepting the change presented by Board Member Cormack. Okay. So we'll take this to a vote. Dolores Trujillo votes yes. Vice President Neela Patel.
Patel, yes.
Board Member Jovita Dominguez.
Dominguez, yes.
Board Member Patricia Nguyen.
Nguyen, yes.
Board Member David Lawler.
Lawler, yes.
Board Member Vicky Granowitz.
Granowitz, yes.
And Board Member Allison Cormack.
Cormack, yes.
Thank you. Moving on to item 5.0. This is the report of the Administrative Committee. And this report will be given by our Assistant Executive Officer, Yvonne Leonard-Taps.
Thank you, and good morning. On behalf of our Executive Officer, Loretta Melby, providing her Executive Officer report, since the last board meeting, she has either met or attended the following activities. She's met with Western Interstate Commission for Higher Education, Healthcare on supporting mental health for healthcare students and young professionals, the Division of Apprenticeship Standards information sessions, met with the Department of Consumer Affairs regarding mentors in nursing. She attended the webinar by NCSBN on the NCLEX admin navigation tips and operation procedures and reminders. She participated on NCSBN's education call. She met with the sponsors of AB 1082 to discuss amendments, presented at the COAD in North and South meetings, met with CANA to discuss AB 876, attended the NCSBN Discipline Conference in Santa Rosa, participated in the IACA Healthcare Subcommittee and quarterly IACA meetings, attended the CACN conference in Sacramento, met with pre-licensure school administrators, met with the Department of Consumer Affairs to discuss the return to work 4 days a week in office for all state employees, met with stakeholders to discuss AB 2104, attended a CNS presentation, participated in the Hospital Association of Southern California Nursing Advisory Council, participated in the MedSpa IV Hydration Task Force with other DCA Healing Arts Boards, attended the DCA Directors Quarterly and the Board Leadership Meeting, met with legislative staff to discuss AB 479, attended the NCSBN mid-year meeting in Pittsburgh with the board president, and attended the COADN conference in Monterey. She also met with the California Community Colleges Chancellor's Office to discuss data sharing, and she provided, we launched the clinical facility approval, also known as CFA, on May 1st, and she has provided multiple trainings to healthcare facilities and academia. And that is her report, the executive office report.
Thank you, Yvonne. Board Member Tricia Nguyen.
Thank you very much, Yvonne, for that. So I'm curious about the returning to 4 days a week in office. The one thing that really was astonishing to me during the shelter in place was how incredibly productive our workforce was working from home, like all the numbers went up. And so I'm hoping that as people return to the office, we'll keep track of productivity levels so that we can compare and contrast, people working from home and people working in the office.
Yes, in implementing the executive orders, returning all of us to the office 4 days a week, we will be documenting any changes, positive or negative, in our production.
Thank you.
And we also are working with staff to help them make an easier transition to hopefully eliminate any slowdowns in the workload.
Thank you.
Any other questions or comments from board members? No? As this was information only, thank you, Yvonne, for presenting. Our executive officer is very busy. I would like to move on in the agenda, but before we do, we can open it up for public comment.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Bobby Dalton Roy would like to make a comment. 1 second, please.
Good morning, board. Again, my name is Bobby Roy. I'm with SEIU Local 1000. My comments are, one, to thank you, board member, for acknowledging the work that was being done even during the pandemic when folks were working from home at the height of the pandemic, and correcting what was said in the executive report that it was return to work. Our position is that everyone who had been working the entire pandemic where they needed to work and getting the work done and doing it at a high quality. I'll also point out that the executive order was written. There is a pending PERB case with several unions, including SEIU Local 1000, because it was a unilateral decision and not made with any consultation with the union, thereby violating the DILS Act. And so we encourage the flexibility to the board and the DCA to use the flexibility that's provided in the executive order as well as in the Cal HR guidance to slow this down, wait for more information so that better data-driven decisions can be made, such as the audit report that will be coming from the Bureau of State Audits, as well as what's going to happen with our budget. The cost we have found is going to be incredibly expensive to grow lease space, to move folks around, to get equipment, to bring people back into the office to do this work when we were getting the work done, being able to work from home. And so we advocate for maximum flexibility, and we hope that the board and the DCA will exercise that. Thank you.
Thank you for your comment. Board President Trujillo, there are no other public requests for comments on the WebEx. Do we have any in-person requests for comments there in your location in BRN HQ?
It doesn't appear that we have any requests for comments here in HQ.
Thank you. Would you like me to close this window?
Yes, please. Thank you.
Thank you.
Okay, we move on to item 5.2. This also is information only. This is a 2022 to 2025 strategic plan and goal progression. Our Assistant Executive Officer will be presenting this portion.
So in the board meeting materials is the strategic plan along with the goal progression chart with everything highlighted that was done since the last board meeting. Our executive officer wanted to highlight a couple items. The Horn engagement, which will be discussed later, has been completed and we are in the closing out process. And she also wanted again to state that she has met with NCSBN to align the temporary licensing process for our out-of-state RNs and work on streamlining that process. She participated with the Department of Healthcare Access and Information, also known as HCI, and the Boston Consulting Group to work on the nursing pipeline, supply and demand, and the importance of a statewide consortium to gather data from the regional focus consortiums to allow for better planning and forecasting. Again, the clinical facility approval, which was a significant accomplishment, was released on May 1st and training has been provided and that clinical facility approval portal is in use. And she continues to work with stakeholders to ensure that there is an understanding that the current law supports academia moving to a competency-based curriculum if that is the chosen path. Again, all the updates are highlighted in yellow, which represents what has been done since the last board meeting. And that is the report.
Thank you, Yvonne. Any questions? Board Member Allison Cormack.
Thank you, President Trujillo. Thank you so much, Ms. Taps-Leonard, for providing this. I want to be sure I understand what the clinical facility authorization database is. Is this that something or other thing? It's not the placements, right? So if you could just just so we all have a little bit more information and don't get, overly excited about having solved one of our biggest problems. I know this is a step in the right direction, though.
So it's the clinical facility approval portal. And what that is in response to the California State Audit 2019-120. And it is the...
I'm going to ask you to move your microphone a little closer. I can imagine if someone's online, they might not be able to hear you very well.
Thank you. So the CFA is in response to the California State Audit Report 2019-120, and it is the first step in allowing us to have data available online, and it's showing it will be used by our educational partners and the healthcare facilities that offer clinical facilities for the clinical rotation. And so it is the first step in order for us to be able to post data online.
Okay, so it's the form that when schools come before us, they say, we promise that this facility is going to provide placements.
Correct.
So it's just that. It's not here's how many are using, which placements, et cetera.
Correct. It replaces the EDPP 18.
18, that was the one. I
And
knew
so
there was a number there.
it is a process that has always been in place, but we just made it automated and easier for
And
everyone to
transparent.
use. Yes.
Wonderful. Okay. And then the only other thing I wanted to talk about, we really don't talk about it very often. It's all good news, is on page 37, 6.3.A.1. I think this work that's been done to provide continuing education for us and frankly for the public has coincided with my service on the board. And I just wanted to take a moment to say that I know it's an effort and appreciate all of the speakers who come. And I think this has been, a really excellent development for the board. And I want to thank the staff for doing it and encourage them to continue. It's meaningful and, will help us make better decisions in the future. Thank you.
Thank you for that. And I'll make sure to relay that to staff. And we have several presentations today that I think will continue that effort.
Okay, any other questions or comments from board members? BRN moderator, can you please open this up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired and will move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Do we have any in-person requests for comments there in BRN HQ?
No, it doesn't appear that we have any requests for comment here in HQ.
Thank you. Would you like me to close this window?
Yes, please. Thank you.
Thank you.
Moving on in the agenda, this is discussion and possible action regarding 2026 board and committee meeting dates.
This one.
Board Member Tricia Nguyen.
Thank you very much. I have a standing last Wednesday of the month board meeting in Santa Cruz. So the March 25th, the June 24th, and the September 23rd are in conflict with that. And I know I'm just one board member, and I always do prioritize this meeting and will continue to do so. But I'm wondering if we could move it 1 week forward and again, I'm just one board member, so I'm just putting it out there. Yeah.
Until the next board meeting.
We can, but can we get all other requests and to see if there's any, any other board members that would conflict with their schedule, if that was to be moved?
Board Member David Lawler.
Nothing, just for the record, no conflicts. I just want you to know, no surprises coming.
Yeah, there's no conflict with me either. Any other questions or comments from board members?
So could we get a motion that that approves it with the possible requested amendment changes by board member Tricia Nguyen?
You want the
Could we just move 1 week forward? So it would be the 3rd week of the month rather than the 4th week of the month? That would be my request. But again, I understand that I'm one of 9 members, so.
So the issue that we have moving it forward is there's only 16 working days on average between committee and board when we have to post. So if we moved it forward another month, it'd be 9 working days, and that would be very difficult.
Okay.
Moving it to the week after puts us
Into the next month.
that puts us in the next month and outside of the quarter, which I don't think we can do.
That's,
Just a matter of a day.
Are
it's
these,
just Wednesday.
are these meetings Wednesday, Thursday?
They are.
And is it a problem to move it to Thursday, Friday?
That's an option.
My conflict is only Wednesday.
Right,
Yeah.
so.
So that's an option if you wanted to explore that.
I'm definitely open to that. Thursday, Friday.
Dominguez is open too.
Yeah,
Okay.
smaller change.
So if you want to make that motion, we can go ahead and make that change and put that forward.
All right.
Thank you.
At this time, I would like to make a motion.
Sure, yeah, I'd be happy to. Yeah, yes, so at this point, I'd like to move that we approve the board and committee meeting schedule for 2026, except on March 25th and 26th, it would be 26th and 27th, June 25th and 26th, and September 24th and 25th. December can stay where it is.
I second David Lawler.
Thank you. BRN moderator, please open us up for public comment.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. Activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment."
Great. Better for me.
Oh, okay.
Because I was one less day of school.
Yeah.
Let's say 13 kills. It would be.
Yes, it
Board
does.
President Trujillo, there are no public requests for comments on the WebEx. Do we have any in-person requests for comments there in BRN HQ?
No, it appears we do not have any requests for comment here in HQ.
Thank you. Would you like me to close this window?
Yes, please. Thank you.
Thank you.
All right, we got a motion and a second on the floor. We'll take it to a vote. Dolores Trujillo votes yes. Vice President Neela Patel,
Patel, yes.
Board Member Jovita Dominguez,
Dominguez, yes.
Board Member Patricia Nguyen,
Win, yes.
Board Member David Lawler,
Lawler, yes.
Board Member Vicky Granowitz,
Granowitz, yes.
and Board Member Allison Cormack.
Cormac, yes.
Okay, thank you. So at this time, we will move on to item 5.5. This is information only, presentation by Cindy Woolston on the post-contract report for DCA contract with Horn.
So, good morning. I will be presenting.
Oh,
this
thank
also.
you, Yvonne.
So I do just want to start off. It is very exciting to make this presentation because I was directly involved in this project. And I think after this report, you will see the tremendous benefit this project came. So the 2022 Budget Act committed over $1.5 billion from the general fund to various Department of Healthcare Access and Information, also known as HCI Workforce, Healthcare, and Development Initiatives over multiple years, collectively known as the Workforce for All initiatives. HCI requested the Department of Consumer Affairs to provide assistance in implementing these comprehensive nursing initiatives aimed to increase the number of nursing professionals in the workforce. The efforts included, but were not limited to reducing licensing processing times to improve access to licensure and customer satisfaction, and improving the process for licensing for out-of-state applicants or endorsement applicants, which would expedite the timeline and increase cost effectiveness while maintaining low application fees. This was a historical event for the Department of Consumer Affairs to receive general fund monies from HCI to provide resources to work on existing workloads supported by a fee revenue fund. Specifically, the Department of Consumer Affairs was awarded $10 million from HCI over a 3-year period for these efforts. However, the funding stream was reduced to $3.75 million due to budget reductions in fiscal year 2024-2025. The $3.57 million awarded from HCI was used by DCA to award a contract to Horn LLP, also known as Horn, for $2.35 million, while $1.43 million was allocated to reassign DCA internal subject matter staff to provide expertise and guidance to improve the BRN licensing process. The full funding was not used as the Horn contract is projected to come under budget, and about $1.2 million will revert to HCI as it was not expended as originally projected for internal resources. So this is the exciting part. Okay, the Horn contract was approved on September 8th, 2023, with the terms of the contract from July 1, 2023 to December 31st, 2024. Horn was not able to be on site until October 16th, 2023, because the contract mandated all their agents and staff to be fingerprinted. And so it took some time to get that done. So the successes of this project included, but were not limited to, first, the workload. During this contract, it was identified that BRN saw an increase of almost 10,000 endorsement applications in 2022, which is likely due to the influx of RNs endorsing into California to assist with the COVID-19 pandemic. And Horn was able to eliminate a backlog of 7,798 registered nurse applications resulting from this influx. Now, not all those were necessarily licensed. Some of those applications were abandoned, but we were able to determine that the applications were abandoned and clear it from a backlog. Additionally, as of December 31st, 2024, the project resulted in the approval of 10,045 nurse licenses by Horn agents. So there was significant assistance to the workload. The next benefit was the concierge service. And the project identified that a concierge service is critical to improving the business process for reviewing applications and licensing nurses. The project showed that processing times for RN applications handled by Horn agents were significantly reduced. Processing times for out-of-state endorsement applications reduced from 174 days to 52 days, calendar days, with an overall average reduction of 122 days between the submission, which is considered the postmark date, and approval. Likewise, processing time for out-of-state examination applications was reduced from 77 to 19 calendar days for applicants from a school that had an NCSBN and a BREEZE school code. So if the school was not previously approved, that took additional time for BRN to get that approval for that code. With an overall average reduction of 58 calendar days between submission and approval. So in this concierge service, the licensing evaluators would conduct an initial review of the applications to ensure all licensing requirements are met. And when deficiencies exist, both phone and email contacts are made to the applicants. This helps in obtaining the missing information and documents required to complete the licensure process in a faster time frame. So what Horn did is they stated that once they reviewed the application, they had X number of days. I believe the first initial contact was 2 days to reach out. If we did not get the information or response from the applicant, if it was phone, the initial, we would send an email. So they had a very strict timeline of when these contacts to the applicants would be made. The concierge service was implemented by the BRN prior to the expiration of the Horn contract. We do not have the exact same timelines for like the 2 and 4 days, but it's very similar. We are still refining our concierge service, but based on the Horn model, we have the foundation that shows that it is successful. And we've received very good feedback from applicants that they appreciated the direct contact. So that's the concierge service, again, already implemented by the BRN staff. The next success was ERAS. And the project developed an electronic enterprise reporting and analytics system known as ERAS. Not a fan of the name, but I'm just one person. This is a tool using Power BI that provides BRN with data refreshed throughout the day that assists with workload management. Currently, ERAS is being used by BRN management, and the team is working on revisions to the tool. Prior to this tool, the BRN staff would run a report every morning. The report was very large, and if we tried to run it during business hours, oftentimes it would crash our system, and not just our system, but DCA's, parts of DCA system. So we had staff that would try to run it at 4:30 in the morning. So with the ERAS tool, we are able to have this information on a dashboard, easily viewable for all supervisories and management. And we are able to have that refresh throughout the day. When Horn originally presented this tool to us, it was only refreshed once. And because applications can be processed very quickly, if it's a completed application, it was determined that we needed at least 2 refreshes during the day, but DCA is working to get us multiple refreshes during the day. So we feel that this is going to be a tremendous tool that we will be able to use for caseload management and tracking and trending performance issues. And this is the first time that the BRN has used a Power BI tool. So there's also exciting for that. The last area was the quality assurance. So during the Horn project, it was determined that quality assurance was necessary. Unfortunately, some mistakes were made, and the Horn team quickly adjusted and developed a quality assurance team, a process with a dedicated team just for quality assurance. Horn recommended the creation of an independent team of qualified BRN staff assigned to quality assurance to quality assurance, the licensure process, it was recommended that the QA team audit samples of all application types as well as applications and specific statuses of the licensing cycle, including but not limited to completed, deficient, abandoned, withdrawn, educational delay, and non-responsive applicants. Currently, we are researching how we could implement a quality assurance element in that. Given the current fiscal state, acquiring additional positions may be difficult. So we're looking to see if there's any internal positions we can redirect in full or in partial. Initially, we envisioned developing a quality assurance team for the entire board, but we're going to scale it down and just start with licensing at first and see what we can do. So some internal staff have already been redirected and are in the process of being trained to support this quality assurance. This will be a small step implementation phase because we just don't have the resources to just develop a team right now. But everything about quality assurance is being implemented within the licensing program at the BRN. So that is the Horn report. But again, I want to state with 3.75 million, with some of it will be reverted back to HCI. Horn was able to license 10,045 RNs. We have been able to implement a concierge service that we believe will continue to be successful. We have a new tool, errors, and then the quality assurance effort. So it was a great endeavor. And as I'd mentioned, it was a historical event for DCA to receive general fund monies. And so we're hoping that in the future, if HCI has any other opportunities, they see the success that this contract had and will look to the BRN and DCA for future opportunities. And that is the report, unless there's questions.
Thank you, Yvonne. That's great news. Any questions or comments? Board Member Allison Cormack.
Thank you so much. I think sometimes when consultants come in, they fix a problem, but then the problem can reappear after they depart. So they solve the immediate problem, but they don't fix it going forward. And it seems like this project has really hit the sweet spot of doing that. That was a lot of words, but some people are better with like numbers and graphs. So I just want to be sure that everyone had a chance to see page 68, because when you look at that graph from October 2023, when they started, to the end of December last year, you can see really the dramatic achievements. So I just, that's just something to be commended. Certainly grateful that, we received it. And I hope also that this is, I liked what you said at the end, that this is a signal to the state broadly that investing in, processes and technology specifically for our state organizations brings the benefits that people expect, consumers expect, right? Especially in this state. So I know there's a lot of opportunities for technology improvement, but I'm delighted to see this one. And it obviously addresses, as I think you probably mentioned, the biggest issue from the audit the time before, the very first one. So congratulations to everyone who worked on it.
Thank you. I just want to add one thing. One of the differences with my experience with consultants, Horn came in and they partnered with us. They learned our process. They identified any root cause analysis, and then they worked with us to develop solutions that could be sustainable long-term, which has been different than other consultants that I have worked with in the past.
Thank you. Board Member Tricia Nguyen.
Yeah, I just want to applaud these efforts also. You just reiterated, Yvonne, that they came in and partnered with you, but I also just want to say you partnered with them. I think sometimes bureaucracies have this, I worked in bureaucracy for a long, long time, this kind of stubborn, no, this isn't the way we do it. And I certainly sense an open-mindedness, recognizing what the problem is and then really doing the work to tackle it. I mean, just eliminating the backlog is so incredible and improving quality. I'm just really delighted by this. It's really kind of government at its best. So I just want to make sure that we take a minute to just applaud the work.
Thank you for that. And I do want to, licensing staff embraced the recommendations that were made as evident by implementing the concierge service before the contract was even over. So, I mean, this is just the beginning. I hope in a year we can report on how these efforts have been built upon and even showing greater return on investments.
Okay, any other questions or comments from board members? All right, BRN moderator, can you please open this up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Do we have any in-person requests for comments there in BRNHQ?
Yeah, it doesn't appear we have any requests for comment here at HQ.
Thank you. Would you like me to close this window?
Yes, please.
Thank you.
All right, moving on to the next agenda item. This is 5.6. And this is also information only. Solution converting fingerprint hard cards to electronic live scan solutions via a contract vendor. Yvonne?
Yes. So we are looking to address an issue when you're out of state, you have to submit your fingerprint images via hard card. We can no longer send a hard card with our information on that hard card until an individual has applied. We have to have jurisdiction over that individual, so that there's a small delay with that process. So what we are trying to do is we've identified at least one vendor that has developed a way of converting a hard card fingerprint to live scan technology. And once we submit that hard card to DOJ, it could take 3 to 12 weeks to get the results back for a hard card, to where live scan is usually within 5 business days. And so we're working on developing a contract with a vendor that would be our vendor to digitize the hard cards into live scan so we can get the results back faster and therefore getting the licenses processed quicker. I'm going to turn it over to Matt because he has the details.
Okay, thank you.
So essentially, this takes a process that we currently don't charge a fee for, and it would pass that fee on to the person asking for the hard card. Right now, what you do is you go on our website, you request a hard card, a staff member for our board gets that information, stuffs a hard card, instructions on how to fill out the hard card, and mails that out. We pay for that mail. We pay for that individual to send that card out. They get that card in the mail in a couple days. They have to then go to a law enforcement agency, roll their fingerprints, and then they mail it back to us. Then it goes to our mailroom, goes to our fingerprint unit, goes to our licensing unit, then goes to DOJ. Then DOJ makes an electronic, and then they submit it. And it, like Yvonne said, that can take weeks. What this would do is it contracts with the DOJ live scan vendor that we would now send 2 hard cards. They'd roll those 2 hard cards, and here's the benefit for those out-of-state folks. A lot of our nurses reject their fingerprints. So if they reject the fingerprints, we have to start that process all over again. They have to request the card, we have to send the card, and we do it all over again. And they often get reject again because nurses wash their hands a lot and they lose their fingerprints. And so it ends up being what's called the name check. After 2 rejects, it's an automatic name check, and then we're done. With this process, we'd send 2 cards, it would go to the vendor would upload it, and then they're allowed by DOJ to keep that second card. Once they get rejected, we notify them of the reject, they'll send that second card. So we're talking about a process that would take maybe weeks to months, going down to days. So Yvonne's right, where when someone we have to wait for them to apply, and often what they're waiting for is that hard card, and everything else is done, but we still are waiting for that. So we're hoping to get this done in a matter of days versus weeks.
Thank you, Matt. That's wonderful news for our nurses who wish to endorse from out of state. Any questions or comments from board members? Patricia Nguyen?
Thanks very much, Matt. Yeah, this is a great step in the right direction. I'm wondering what the fee is. So we've been absorbing the fee and we're going to pass the fee on now.
So we don't actually know yet because we've done an invitation to bid. We've heard anywhere between $51 to $99 to the applicant, on top of the $49 fee. But yeah. And we won't know until we get our bids back.
So currently it's $49?
The FBI DOJ fee is $49.
Got it.
The vendor's going to charge an additional fee on top of that to do this process. And that's what could be an additional $51 to $99.
But it definitely speeds up the process.
It would definitely speed up the process.
Yes, good.
When you're looking at the fees to the RN, the applicants, also know that they have rolling fees. Law enforcement can charge rolling fees, and we have no control over that cost.
Okay. All right. Any other questions or comments from board members?
And just one other thing, our executive officer does support this.
Yes, she
effort.
does. All right, BRN moderator, can you please open us up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Do we have any in-person requests for comments there in BRN HQ?
No, it doesn't appear we have any other requests for comments here at HQ.
Thank you. Would you like me to close this window?
Yes, please. Thank you.
Thank you.
All right, 5.7, this is information only. This is the inherent risk to public servants. We're going to defer 5.7 to the next board meeting at this time. So at this time, we would like to take a 15-minute break. And we'll come back at 10:30.
Just a couple of other things I just want to make sure.
Good morning. We are now back from our 15-minute break, sorry. And we will continue the meeting. Moving on to the next item in the agenda. Before we move on to the next item in the agenda, we will take roll to establish our quorum once again. Dolores Trujillo present, Vice President Neil Patel,
Patel present.
Board Member Jovita Dominguez,
Dominguez present.
Board Member Patricia Nguyen,
Nguyen present.
Board Member David Lawler,
All are present.
Board Member Vicky Granowitz,
Granowitz present.
and Board Member Allison Cormack.
Cormac present.
Good. Quorum has been established. We're going to move on to item 6.0. This is the BRN Future Priorities and Proposals for Review and Possible Action. 6.1, this is a discussion and possible action regarding joining the National Council of State Boards of Nursing, NCSBN, Pre-Licensure Annual Report Core Data Survey. This presentation is to be given by Nancy Spector. Has she been elevated? Is she on?
She's elevated. Oh, there she is.
Now you
There
can
she is.
hear me. Hello, everybody. I'm Nancy
Hello.
Spector, and I'm trying to share my, I just have a little PowerPoint for you. I did send it, but I don't know if I sent it to the right person, and I also sent it to Lori, and she's not there, but, oh, here, maybe. Okay. Okay, let's see. Well, I don't know. Okay, maybe I can't share it, but
Nancy, this is
Yeah.
Reza. If you'd like, we can have you send it to somebody else so that we can get it on screen if you think it'd be helpful.
I do think it would be helpful. I did send it to somebody else as well, but I don't know. It was in Lori's email address.
Would you send it if you have the ability right now to
Mhm.
Yvonne, EVON
Oh,
dot?
that's, I sent it to Yvonne.
Oh.
I did this morning.
Okay, I think she's pulling it up.
Okay, good.
And if you have a camera and the ability to,
Oh, the video? Okay.
if you're able to.
Let's see. Is it Surface Front? Let's see.
We don't see you yet.
Yeah. Okay. So I see myself, but how do I make you see it? Oh,
There you go.
okay, perfect. Okay, well, thank you, everybody. I really appreciate
Just bear with us just a moment. I think we're working on getting those slides up.
Okay, I really appreciate your willingness to, just hear about why we think it would be really helpful to you to join the annual report program that we have at NCSBN. We currently have 35 states that have joined. And okay, so it is up. I think I can turn there. Okay, so we are just so excited with how it has gone. Remember, it started back in 2020 in September, and that was when the pandemic was going full blast, and we worried about the boards being able to do it at the same time, and we even then had 20, so it was really great. Next slide, please. In the nutshell, kind of, I find these as the most important reasons that you might want to join. First of all, we have only 50 core questions. That is amazing for something like an annual report, and we found that from some of the other boards. They are either demographic questions, and many of these are very valuable, not only to the board in your state, but also to legislators. They like to know how many seats are available, and many times they don't know that, and they go to states and they try to increase capacity way beyond what the nursing programs can do, and there's really capacity already there. We are finding, because we ask about seats, it's really the number of students they can enroll, and in some cases that is because the faculty aren't getting paid enough, and so there are some states that have gone to their legislators, given them the data, and they've actually gotten money to pay faculty more. And then we collect data on evidence-based quality indicators. So we have national data on nursing education programs with quality indicators. And that is something that's really new to nursing, not only in the United States, but also across the world. In fact, I'm going to be talking about this at the ICN meeting in a couple of weeks. And we are able to collect consistent data across all the states. We found that before, when we looked at the data from annual reports, many of the states collected all different kinds of data, and it was really hard to see the national data. And then every year, we put on our website the aggregate data. So from right now, all the 35 states that have joined, what the aggregate data is, both in terms of demographics and also quality indicators, so that both boards of nursing, but also faculty, can benchmark their programs to national data. We have a dashboard of aggregate results that's being launched. We just have one more review to do, and it'll be launched. And that is fabulous. I'm going to show you a picture of it in just a second. And then statewide aggregate data reports are being considered. And that would really be exciting because the states then can look at what they're doing compared to nationally. And in fact, we have one state right now that we're working on with that. And then every 5 years, we do a sophisticated statistical analysis on the quality indicators. Remember, 5 years ago we did it, but now we're doing it again this year. So our research department is doing that. So this is really such a valuable project. Next slide, please. And you'll be able to see this is the overview of our new dashboard. It is a dashboard that'll be available to everybody from faculty to boards of nursing to anybody in the public. And this is just the first page. I'm not going to show you everything because I'm told I only have 10 to 15 minutes. So, but it is a wonderful because you can go down and compare. You can compare the differences between the different degree programs, practical nurse versus the diploma versus associate degree, BSN, et cetera, geography, if it's urban, if it's rural, ownership, et cetera, for-profit versus not-for-profit or public. Next slide, please. So, and these then are the key quality indicators. We have other quality indicators as well, and they're all on the aggregate report, all of them, but these are the key ones. And we are seeing, I was surprised, I've been faculty before I came to NCSB, and I was really surprised at the less than 35% full-time faculty. That's a key quality indicator, but meaning statistically affects the outcomes of the program. And you would be surprised to see how many programs have like 10% of full-time faculty. There was one program that called us and said, we can't fill this out because we have no full-time faculty. And so these are all very important in looking at, for example, the director turnover, more than 3 directors in 5 years, statistically poor outcomes. And you probably know this as well. We didn't find annual NCLEX pass rates to be, a quality indicator. In other words, it wasn't statistically significant, but the NCLEX trends were. So we're collecting on 5 years of trends, and we're working with our research department to get a trend analysis so that you could see like maybe +1 or -1. Next slide, please. I have to stay within my time limit here. So the next slide, we're just going to talk about the impact. In terms of looking at it statewide, these are some of the areas that either the boards of nursing or also the educators have been able to share the data. I think it's really great that they're sharing it with employers. When we're talking about academic practice partnerships, and there's a national group looking at that right now, really important to share some of this with employers so that, they don't just think, well, we're not getting students that are competent, but, that they have a responsibility with it as well. I also think it's great that it goes to the Center for Nursing because, again, it'll highlight your state and how that it's doing. Next slide, please. But, in terms of looking at how faculty and boards of nursing can use these guidelines, I think one of the best things is that it really promotes that collaboration between the Board of Nursing and the education programs. And sometimes regulation, as you probably know, is seen as, well, they're just the ones that give sanctions and you have to be afraid of them. And, I go to all the national education conferences, and I have found that if I sit at a table and they say, well, why don't you ask your Board of Nursing about that? They'll say, oh, no, we're too scared to go. But this really promotes that collaboration, and it promotes it because you can be proactive before their outcomes fall, before their NCLEX pass rates fall, or any other outcomes, graduation rates, for example. And then you can say, look, in these 5 quality indicators, you need to work on improvement, and then you'll be able to bring your program up before any of the outcomes fail. So it really does promote that collaboration and really give suggestions for the quality improvement that can be made. And it gives them ideas for how they can self-evaluate, because it's all based on the evidence. And that is so important, and gives guidelines for establishing new programs. And, as you probably have in the state of California, we see a lot of new programs being developed because of this this nursing shortage, and then establishes credibility for making improvements. You have reasons for making them. Next slide, please. So I love these examples from faculty, and these are from surveys that we did. So, what have you found? How have you found it helpful? Well, in many cases, it's these hot topics that are in their state: student enrollment or diversity, turnover, director turnover, especially admissions, retention of students. All of those were hot topics that they were able to, see the numbers for. And then enrollments in one state were used to support legislation for grants. And, they provided the data to the state library so that all the legislators can see it. So if the legislators go, they can see how many seats their programs have in that state. And maybe it's more of a problem of recruiting and retaining faculty. And maybe they need to look at salaries. Next slide, please, of faculty. And, there's looking at that 35% full-time faculty rate, really important for programs, then they can see that they have to start looking at their adjunct and part-time faculty and how they're using them. We have found we added up, we give a summary of how many adjunct faculty would be in California and how many full-time faculty, and we're finding more adjunct faculty than full-time faculty. And then again, benchmarking, really important, and particularly for direct patient care hours. And I do know that California is really, really into this, and certainly I've taught that is where the students learn. So that is really important. And I loved this last one. 3 programs actually use these data from the annual report to go to administration and say, look, this is a national quality indicator, 35% full-time faculty, and we don't have it. We need this. And they showed the percentages of the nationally versus theirs, and they were awarded full-time faculty slots because of these data. Next slide, please. Now, it also is, provides data for the boards of nursing. And so there was one board that was having a hard time knowing what to do when the pass rates were for more than 2 years were below what they should have been. And then the annual report helped them with data to make those decisions. And some of them use the data for revising their nursing education regulations, particularly the quality indicator data. And we have that in the model rules as well now. And then, some are considering integrating that. Next slide, please. And then staff use the data when making site visits. So this is that collaboration. They can say, well, oh, great, you have improved in this, and now your outcomes are still good. Or, you've gone downhill, I'm afraid about outcomes, and you can really collaborate nicely. And again, the next one, they fostered those closer relationships, provided data for the programs to make their improvements, and decreased the work of their Board of Nursing. In one state, they were telling us that we decreased our work on the annual report by about 80%. Because remember, we collect and verify and clean all of the data and then, give you that report at the end. Next slide, please. And this is the end. This is a win-win situation, and we so hope to see you come aboard. And it's not only that you get those evidence-based annual reports, which are so important, but you are part of that first ever nursing education database, and so valuable to the nursing education community because you have so many programs in California. So we really do hope you join. And the next slide is just if you have any questions, and I don't even know if I have time for questions because maybe I went over about a minute, but are there any questions?
If California, hi Nancy, this is Dolores.
Hi.
If California participated, how long would it be for us to receive our first indicators of this study or of the data?
Your first report?
Yeah.
That's a great question. We say it's 3 weeks after all of the data are verified. Now, when I say verified, the faculty sometimes make mistakes in entering the data. In one case in Texas, for example, they had 283 males in their program and 24 females. And so, we go back and we verify outliers or anything like that. If we can get it verified, that means we contact the program, they give us back the information, nothing you have to do. If we can get that done in 3 weeks, then it's 3 weeks. Now, it depends on your programs. And sometimes if you really need it, you need it for your board meeting or something, sometimes what we can do is ask the boards of nursing. We'll say, can you reach out to these 5 programs and see if they'll get back to us? Because believe me, programs get back to you much sooner than they get back to us. So we like to say 3 weeks after the data is verified, but it does mean how long it'll take for the data to be verified. Does that answer it?
Yes, thank you.
Oh, I'm
Any
sorry.
questions or comments from board members? Board member Allison Cormack?
Thank you, Ms. Spector, for providing this information. It's really helpful to look at the data. Thank you for the attachment. I'm wondering what the cost is. Is there a cost for the state of California BRN to participate in this?
We do this for the boards of nursing, no cost.
Okay. And the survey is sent via email, so the BRN provides you the email information of the various directors?
What we do, and again, it's because the programs answer boards of nursing more than they do us. We get the survey all made and, the board of nursing approves it. Okay, this is great because you have additional questions. Our core questions are always the same, but your additional questions, if you have some, you want to approve. We then send you the link and the PDF, and you send it out to all your programs. And then we get the data back because it's through Qualtrics. So we get it back. You don't have to get the data back or anything.
I love Qualtrics. That's great.
Yeah.
Okay. So it doesn't sound like a big lift then for the people who are answering the survey.
No, it really isn't. It depends on the additional questions. We did have one state that had a lot of additional questions and they were all complicated. We try to help the boards with not making it so complicated, but sometimes we just have to give in. And the faculty reached out and they said, we don't want to do this anymore. This is too much work. And so they were able to redo and revise their additional questions, and then faculty were happy. But it really depends on the additional questions. The first 50 questions that we ask are, pretty straightforward, not complicated, and they should have the data right there available.
Great. Thank you so much.
Board member Patricia Nguyen?
Thank you very much. Thanks for this presentation. I have 2 questions. One is why are we not a member already? Have there been, I'm sure we've been asked before. Yvonne or Matt or Dolores, have we heard this discussion before?
No, this is the first time
Well,
for me.
Nancy, you have any ideas?
I don't have any ideas, but I have, in March, I did give a presentation.
Yes.
Yeah. And then in August about why approval. But I don't know. I haven't, Laura has not told me, maybe just, thinking about it. I think you do have a group in UCSF that does annual reports for you. And if that's the case, Texas has the same thing, Virginia has the same thing. They just do both. They let
Yeah, we're going to do both if we participate in this. We will continue to receive the survey from UCSF
Right.
also.
Yeah, and that's what Virginia and Texas do, and they're happy with it, and their faculty are happy with it.
Do you have anything?
And the presentation in March was to the Nursing Education Workforce Advisory Committee, not to the
Not to
board.
the board.
Correct.
And then would this result in any additional workload for our staff? I mean, beyond, forwarding emails and things like that. I mean, this is a tough year to ask staff to do additional work, so.
It appears that the workload would be minor and absorbable.
Okay.
We realize that, and that's the case all over. And so we do our best, and we have directions. And we say, if there are any questions, reach out to us. And we have the name of Kiana McIntosh. They reach out to her. We do all again of that cleaning and verifying. So when you get the report, you don't say, well, why is this and why is this? Because we've done that all. I don't think there's much extra work except maybe for sending out, first the link and the PDF. We send you the report. The report has graphs and matrices, and we think it's pretty easy to read and understand. So I don't think there's any at all, really, except for sending out those first links.
I know Lori was, she would like to contribute to this because it provides consistent data at a national level.
Yeah.
So, any other questions or comments from board members?
I just want, in response to your question, we can document the workload and report out to the board if there is workload that we did not foresee.
Thank you.
Vicki Granowitz?
Actually, my colleagues asked the same question I wanted to ask because it seems like a no-brainer, so I couldn't figure out why we hadn't participated already. And then I had the question about extra responsibilities for staff time, so I'm in support.
Okay. Board Member David Lawler, thank you, Vicki.
Thank you. I just was going to comment that, yes, more data is always better. But my question is, do you need a motion to take action on this now?
Do.
Can I make a motion to
Sure.
join NCSBN in this manner with the understanding we don't lose our old UCSF?
Sure.
I'll second that.
All right. So we have a motion and a second on the floor. Nancy, do you have anything else to say before we move to public comment?
No, I don't think so. There's been some great questions asked.
All right,
Thank you.
BRN moderator, can you please open us up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Do we have any in-person requests for comments there in BRN HQ?
No, we do not have any requests for comment here in HQ.
Thank you. Would you like me to close this window?
Yes, please. Thank you. All right. We have a motion and a second on the floor. Dolores Trujillo votes yes. Vice President Nilu Patel.
Patel, yes.
Board Member Jovita Dominguez.
Dominguez, yes.
Board Member Patricia Nguyen.
Nguyen, yes.
Board Member David Lawler.
Lawler, yes.
Board Member Vicki Granowitz.
Granowitz, yes.
And Board Member Allison Cormack.
Cormack, yes.
Thank you. Moving on to the agenda. This is item 7.0. This is the report of the Nurse Practice Committee, which will be given. Are they here? Okay, moving back to a couple of items that we reordered the agenda on. This is item 5.4. So this is information only. This is a presentation by DCA Budget Office on 5.4.1 registered nursing fund condition and 5.4.2 board member roles and responsibilities related to the board budget.
Good morning. My name is Luke Fitzgerald. I'm a budget analyst with the DCA Budget Office, and I'm joined by Budget Manager Suzanne Balkus. I'd like to thank I'm sorry. Yes. I'd like to thank the board and executive staff for allowing me a few minutes to present on agenda item 5.4.1, the board's memo, expenditure and revenue projections and fund condition statement. The first document I'm going to be going over is the budget memo, which is going to be page number 49 of your meeting materials. This will give you a general overview of the board's budget, as well as a percentage of the budget used and counted towards expenditures. In the 2023-24 year-end summary, the board was appropriated about $66.5 million and spent an estimated $61.5 million, which resulted in savings of $5 million. In current year 2024-25, the board was appropriated about $65.9 million and spent approximately $63 million, or 95.58%, of which $25.3 million was expended on personal service costs, 26.7 on operating expenses and equipment, which includes contracts, purchases, and travel, and approximately $11 million on enforcement, which is for Attorney General and Office of Administrative Hearings. The board is estimated to have approximately $3 million, or 4.42% in reversions. The next page we'll go over is going to be the board's expenditures, which is number 46 of your materials. These projections are based on actual data through fiscal month 9. This report includes 2023-24 actual expenditures in green, as well as 2024-25 budgeted and projected expenditures in blue and orange, which also includes a budget allocation breakdown. Over this 2-year period, costs are relatively higher. As we move towards the end of the document, you'll see that this is a breakdown of the memo. The board had a beginning base budget of approximately $65.9 million, minus the estimated May revise of $2.1 million, and is projected to spend approximately $62 million, creating a reversion to the board's fund of approximately $775,000, or 1.24%. The next document is going to be the board's revenue projections, which is page number 48 of your materials. This report includes receipts collected through March and projected revenue to year end. And I'll actually go further into these projections as we transition to the next slide. The last slide is going to be page number 47 of your materials, which is the board's fund condition statement. And as a quick reminder, we read this document from top to bottom and left to right. The left column is going to be the board's prior year 2023-24 actuals. It shows the board began 2023-24 with a beginning balance of just over $77 million. Collected roughly $77 million in revenues, with $23 million from initial license fees, about $51 million from license renewals, and $3 million from the issuance of citations, fines, delinquent fees, and other revenue. And then below that, you'll see the loan to the general fund of $65 million. The board expended $62.5 million, which includes $4 million in direct draws to the fund for statewide prorate and pension payments. The board ended 2023-24 with $27 million in reserve balance, or about 5.9 months in reserve. For the current year, the board projects revenues of $78 million, with almost $22 million projected from initial license fees, roughly $52 million from renewal fees, and $4 million from the issuance of citations, fines, delinquent fees, and interest on the loan repayment and other revenue. And then below that, you'll see the loan repayment for the general fund of $30 million. The board's 2024-25 expenditures based on the governor's budget with fiscal month 9 projections is approximately $54.8 million between authorized expenditures and direct draws to the fund, leaving the board with a fund balance of $80.6 million, or about 14.8 months in reserve. The budget office will continue to monitor the board revenue and expenditures and report back to the board with monthly expenditure projections as we continue to close fiscal months in the current fiscal year. And then a few things to note on the board's fund condition. The fund condition is a snapshot in time. One of the main factors driving expenditure increases in future years is a result of personal service adjustments. These include general salary increases as well as employee compensation and retirement rate adjustments. The Budget Office includes a conservative ongoing 3% increase to expenditures on the fund condition statement to account for these ongoing incremental adjustments. You'll also notice that revenue is projected higher in the out years. And then lastly, I'd like to note to the board that any future legislation or unanticipated events could result in the board's need for additional resources, which could create cost pressure on the fund. Again, thank you for allowing me the time to present at today's meeting, and I'll now be happy to answer any questions.
Board Member Allison Cormack.
Thank you, as always, Mr. Fitzgerald and Ms. Balkis. It's nice to see you in person. Thank you for coming. I think everything looks great. You know, hitting a budget at 99%, that's some pretty good forecasting. So well done on that. And then looking at the fund condition, I can see that the out years for 4129400 other regulatory licenses and permits, which are the out-of-state endorsements, which had been concerning me because they'd been pretty high, have been brought down to a level that looks really reasonable. I appreciate seeing that. And then the months in reserve look nice and consistent. So thank you as always for your attention to this, and I'm very comfortable with how the numbers look today.
Thank you, Allison. Board Member Patricia Nguyen.
So the months in reserve caught my attention. 18.6, next year in months in reserve. That seems very, very high for an organization. I mean, a lot of budgets that I look at is more like 4 or 5 months and you feel like you're doing great. Could we just could you just maybe tell me kind of why we have so much in reserve and if that's a good thing? I mean, it's always great to have money in the bank, but I'm just wondering if that's a good number for us.
So one of the reasons of the increase is after COVID, you saw a lot of endorsements, and that went about almost 5 million, 4 million additional. So that put a high impact on the board. The 19.9, it is actually healthy. The maximum that we like to see is 2 years, 24 months, but it is a healthy trend that it is, and we're seeing that the endorsement fees is actually going down and the revenue is going down and the expenditure is increasing. So that should hopefully help a little bit. Yes.
Okay, that's very helpful to me. Thank you. And then the only other question I have is looking on page 49, when you break down the percentages on what we're spending, is that kind of normal for an organization such as ours? I mean, does that align with a lot of the DCA boards where we're spending, 38 on personal services and 40 on operating expenses?
So yes, so the operating and expenses is going to be any contracts, and that is normal for a big board, as well as the personal services. A lot of almost a third, we always say that it is going to be for personal services.
Okay.
So that is actually trending the same as everybody else. And the other part is the enforcement. It is within the reasonable.
Good.
Yeah.
Thank you.
Thank you.
That's helpful to me.
When you say personal services, are you talking about personnel?
We call it personal services. It's personal.
Got it.
Services, yes.
All right. Thank you. Any other questions or comments from board members? All right. Thank you. As this is information only, we will move on to board member roles and responsibilities relating to the board budget. Let's just open. BRN moderator, please open us for public comment at this time.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Bobby Dalton Roy would like to make a comment. 1 second, please.
Good morning, Bobby Roy of SEIU Local 1000, Barton Unit 21 Chair. I just wanted to highlight for the related to the personnel services, the wages of your nursing education consultants tops out at $10,900, which is well below the market rate of an RN that's graduating from one of the schools, and unfortunately just doesn't compete with the market rate. And so the concern for vacancies is a large one for us, but as should be for the BRN and the DCA as a whole, because the nursing education consultants are also in the Board of Vocational Nursing and Psychiatric Technicians. So I just wanted to highlight that, and if whatever can be done to help close that gap, such as that Cal HR 1715 process would be greatly appreciated, and we would be happy to align with you all on that. Thank you.
Thank you for your comment. Board President Trujillo, there are no other public requests for comments on the WebEx. We have no, do we have any public requests for comments in person there in BRN HQ?
No, we do not have any requests for comment here in HQ.
Thank you. Would you like me to close this window?
Yes, please. Thank you.
Thank you.
At this time, we're at agenda 5.4.2. This is board member roles and responsibilities relating to the board budget.
Hello, board members. I'm Sam Dyer with the Budget Office. Do we have slides available, or should I just talk through them? They're in the material. Okay.
If you,
And are they on the screen?
Okay, and should I just say next slide when I'm, okay. So hello, board members. I'm Sam Dyer with the DCA Budget Office. I'll be talking about how to navigate the budget process. So the stages of the process, how budgets are built, and the role of the board. We'll start with an introduction of our budget office at DCA. Then we'll overview the annual budget process, the methods for building your budget through incremental budgeting, and the fiscal responsibilities of the board. We'll close by answering any comments or questions that you have. Next slide. So the budget office prepares and builds the annual budget for all of the programs at DCA. This includes facilitating communication between boards and other agencies like the Department of Finance, BCSH agency, and the legislature. It also includes maintaining and updating the board's financial statements and projections. Building the annual budget comes in 3 stages. Stage 1 is the development of the governor's budget, which releases on January 10th. Stage 2 is the spring process and the development of the Budget Act, which releases on June 15th. And stage 3 is the implementation of the Budget Act in the budget year. Next slide. This flow chart illustrates the 3 stages of the budget process. The fiscal year begins on July 1st. The Budget Act for the current year took effect on July 1st. So in stage 1, from August to December, departments begin making adjustments to the enacted budget, making additions or subtractions. These can look like, for example, employee compensation adjustments, retirement rate adjustments, or budget change proposals. These adjustments made to the Budget Act are built into the governor's budget, which is released on January 10th. The governor's budget is accompanied by a budget bill. In stage 2, from February to June, the state assembly and the state senate consider what's been introduced in the governor's budget, and there begins a process for the legislature and the administration to negotiate the budget. This spring process is a period of hearings, negotiations, and meetings between lawmakers to consider what's included in the governor's budget and determine if it needs to be increased or decreased. It culminates in the May revision in the month of May. The governor's budget plus or minus the difference in the May revision is what we see in the enacted budget. By June 15th, the budget bill passes through the legislature to the governor and upon signature becomes the Budget Act. Stage 3 is the implementation of the Budget Act in the budget year beginning on July 1st. The Budget Act is what tells departments their appropriations, the levels within which they can spend during that year. The DCA Budget Office works with its boards to help them operate within their budgeted levels, track the condition of their funds, and project their condition into future years. Next slide. The release of the governor's budget on January 10th to the legislature is required by the state constitution in Article 4, Section 12. The state constitution also requires that the legislature pass the budget bill to the governor by June 15th so that he can sign it into law. Next slide. The approach that we use to build a budget is called incremental budgeting. This approach uses the current departmental level of funding as a base amount to be adjusted. The budget change proposal, or the BCP, submitted to the Department of Finance has been the traditional decision document which proposes a change to an existing budget level. But there are multiple ways to go about changing the budget. The three main methods we will discuss are statewide budget letters, budget change proposals, and legislative changes. Next slide. Statewide budget letters are budget adjustments issued statewide by the Department of Finance. There are certain budget letters that are issued yearly to every department, such as the salaries and wages drill, retirement rate adjustments, and employee compensation adjustments. The Department of Finance can also issue other budget letters, such as those that reflect the priorities of the administration. And for the next slide, I'll invite Suzanne to talk more about the 2024 budget letters.
Thank you. This year, the Budget Office received two budget letters that will impact the board's appropriation. The first one is the Vacancy Saving and Position Elimination, BL 2420. Department of Finance issued the budget letter 2420, Vacancy Savings and Position Elimination, to reduce the state workforce by 10,000 positions and $1.5 billion or $762 million in general fund and $738 million in special fund. The budget letter 2420 reduce will be effective starting 24-25 and ongoing, while the position elimination identified will become effective 25-26 and ongoing. The second budget letter was the Government Efficiencies Reduction, budget letter 24-24. The Department of Finance issued the budget letter 24-24, and this letter provides instructions to implement the Control Section 4.05 reduction required in the 2024 Budget Act for the development of the 25-26 governor's budget.
The second method of incremental budgeting is the budget change proposal, or BCP. A BCP requests additional resources. These resources can be money or they can be positions. These proposals are always data-driven. So to give a quick example, if the board has 4 staff who collectively can process 40 applications per year and they're receiving 50 per year, they could submit a BCP to the Department of Finance for 1 more staff member, initiating a change to the budget. And then for this board, the board has a legislative BCP included in the governor's budget, and that's for SB 639, the one position for CE compliance. Next slide. And then the third method of incremental budgeting is a legislative change to the budget. After the governor's budget and budget bill rollout, the spring process happens. Items are heard by the legislature, who has the power to approve or to deny. Denying equals a reduction in the governor's budget, and they can also add items that did not originate within the department, and this equals an increase in the governor's budget. Next slide. And from here, Suzanne will talk about fiscal responsibilities.
Thank you, Sam. I will be going over the fiscal responsibilities. The board have to operate within its budget and cannot exceed their appropriation. In addition, the board must comply with all restrictions and limitations set by the legislature. The Budget Office monitors the board's fund, expenditure, and revenue in a monthly basis and report it to the board. As a reminder, board members have a fiduciary responsibility to ensure the board maintains expenditures within their authorized appropriation and can do so by reviewing the board's budget report and expenditure projection on a routine basis. Next slide, please. The board's budget is the amount they have been appropriated to spend during a specific fiscal year. Again, this amount changes every year. The Budget Office tracks the board's budget monthly by using projections, which is a tool used to monitor a board's expenditure and revenue throughout the fiscal year, and can assist the board in making financial decisions while also ensuring the board keeps its expenses within their authorized appropriation. These reports are updated on a monthly basis and are regularly provided as an item in the board meeting. Budget reports provide board members with an opportunity to see how the board is expending its funds, with all expenses broken out into categories such as personal services, which includes salaries and benefits, operating expenses, which includes rent, equipment, and enforcement costs, to name a few. We also track revenue and reimbursements to ensure we are on track of what was projected to bring in by the end of the fiscal year. We will communicate and work with the board if we have any questions or concerns. Next slide, please. What you will see in the expenditure document is the board's budget, how much the board spent in each line item, current year and prior year expenditure, what have been encumbered, and what we are projecting to year end and any remaining balances. Next, please. What's the relation between the fund and the budget? Your budget is appropriated from your fund. It's similar to how a check takes money from a checking account. The budget office monitors the board's fund using the fund condition. A fund condition is the document that provides an overview of the status of a board's special fund. This document displays multiple fiscal years and provides a board's past year actual, current year authorized, and budget year estimated revenue, expenditure, and fund balance. The fund condition provides the board's beginning balance, which is based on a prior year end balance, prior year adjustments, which is any purchases or revenue that came this fiscal year for a previous year. Revenues, which is actuals for prior year, projected for current year, or based on Governor's budget or Budget Act. For budget year and ongoing, depending on where we are at in the budget process. And also the expenditure is based on actuals in prior year, projection in current year, and Governor's budget or Budget Act in budget year, and budget year +1 is based on 3% increase. And the increase is to account for any adjustment through bargaining unit or budget letters. Next slide, please. And the fund balance or reserve, these are tools used to monitor and project the future health of the board's special fund and determine if the fund's balance is growing or declining. Using this tool, board can determine when fee increase may be needed to address declined fund balance, or if a fee needs to be lowered in the rare case that the board fund balance is growing beyond the statutory mandate. A commonly used metric to monitor a fund health is months in reserve. This metric takes the ending fund balance for a specific fiscal year and compare it to the board's total authorized expenditure, providing the total months a fund could sustain operating, assuming no additional revenue was collected. For example, a fund with 12 months in reserve could sustain operating for a full year without any revenue being collected. Pursuant to the current law, the board may not have more than 24 months in reserve. And we have, Matt is going to be discussing more about the roles and responsibilities. And I'm available for any questions.
Hello, my name is Matt Nishamini. I'm also with the DCA Budget Office. I believe we have another slide deck to go through. All right, so I'm a senior fiscal advisor in the Budget Office. I'm also housed in the DCA Regulations Unit up in Legal Affairs. I've been with DCA for 10 years. Prior to that, I spent 7 years at the Department of Finance, 3 years with the DCA assignment. So I'm well versed with all the DCA programs and budgets. I currently manage and complete, along with my colleague Sam Dyer, the economic and fiscal analyses for every regulatory package that goes through the department. We also lead the analyses for all fee exams, fee increases, adjustments, license fees, exam fees, et cetera, and the projected revenues derived from any fee adjustments. This includes regulatory and statutory proposals. We also help lead a biannual review once upon the release of the governor's budget in January, and second upon the enactment of the Budget Act in July, of every DCA fund. It's approximately 60 funds. This analysis is provided to the administration, to the governor's office, to agency, as well as to the legislature, so they are aware of the health and status of each fund in the department of any possible future actions needed. First, we'd like to thank the board members and the executive officer for inviting us here today and for serving and doing the important work of the California Board of Nursing. Before we dive into this presentation, I'd like to provide some context and background about the state's current fiscal climate. To do that, we really need to go back to 2020, to the COVID-19 pandemic. At that time, this board was transitioning its EO to its current leadership. Ms. Melby was appointed in 2020, right at the onset of the pandemic. COVID resulted in significant budgetary cuts, forced reductions ordered by the governor. DCA and this board had to navigate all of the impacts from COVID, working remotely while also staying focused and efficient while implementing and maintaining licensing and enforcement operations, and notably implementing these forced budget cuts. But we made it out of those times. Today, and what really started nearly 2 years ago, we are again facing forced budget cuts. The state is currently experiencing a fiscal climate, a structural imbalance where tax revenues are insufficient to fully fund general fund obligations. And while this board is not traditionally funded with general fund, except for HCI, as a state body under the administration, we are obligated to comply with the administration's orders. We'll talk more about the BRN being part of the administration and how it necessarily puts limitations and constraints on the board's operations. The May revision was released earlier this month, as noted earlier, and includes cost-saving solutions of approximately $2.1 million for this board. Budget reductions. The legislature has until June 15th to pass the 25-26 budget, so we'll know a lot more in the coming weeks. But make no mistake, the fiscal situation could get worse. We'd note the governor's budget released this past January was a balanced budget, but the May revision identified an additional $12 billion revenue shortfall. My office would like to take this opportunity to thank your executive officer, Ms. Melby, as well as her executive leadership team and board staff in navigating these past 5 years, and for being steady partners in setting the path forward. Ms. Melby's thorough grasp of the nursing profession, combined with her programmatic, policy, and administrative knowledge, her state budget acumen, and understanding of the state's government's ecosystem is invaluable. You will find no better EO anywhere in state service. And I would also like to thank her personally, as my wife is an RN and has been a licensee for many, many years. And so I also see the benefits of this board through my wife's eyes too. We're going to be using some analogies for this presentation today, which I hope will resonate and connect with you. And since we just celebrated Memorial Day weekend, and because my father served as a naval medical officer and OBGYN, we use some military naval analogies to help illustrate your duties and responsibilities. We'd also like to recognize and thank all of our U.S. service members, both past and present, for their service. So please, we'd like you to first imagine this board as a giant naval ship, an aircraft carrier. Ms. Melby, she's the captain. And DCA, along with all the boards and bureaus, that's the Pacific Naval Fleet. And you board members, you are the admirals giving the directions, the strategies, the oversight to the ship. But remember, aircraft carriers are large vessels and they don't always turn on the dime. And so it takes planning and preparation and coordination. So let's begin. Next slide, please. Oh, this slide, please. So fiscal and budget responsibilities, roles and responsibilities. To fully understand your roles and how board members can serve a vital role in state government, we must understand how we all fit into the state government ecosystem. how we fit into the hierarchy of the administration. We'll talk about a framework, a construct, an ecosystem. We're going to look at the statutes and the regulations that establish that framework. Business and Professions Code, the Nursing Practice Act, as well as the California Code of Regulations. We're going to look at the administration from the governor to the Business Consumer Services and Housing Agency to DCA, and then through the board. Next slide, please. Thank you. So California laws and regulations, they establish the framework, what the BRN is authorized to do, and perhaps some limitations. And we'll show you how BRN fits into this broader ecosystem we call state government. Next slide, please. Next slide, please. Okay, Business and Profession Codes, Division 1, Chapter 1. This establishes the Department of Consumer Affairs. It establishes the department within the agency. And then right at the beginning, Section 101 establishes the board within DCA. So now we're seeing a clear line from the administration, from the governor's office, through agency, through DCA, to the board. Section 101.6, again, right at the beginning, says that all DCA boards and bureaus, their purpose is to provide public protection, to regulate their profession, the nursing profession, and the others. Section 150 establishes the director of DCA, and 151 authorizes the governor to appoint the director. So our director works for the governor. Again, we're seeing that line. Next slide, please. The Nursing Practice Act, beginning with Section 2700. 2701 establishes the board with you 9 board members. 2702, you board members are appointed, some of you by the governor's office and others by the legislature. So again, while you are a semi-autonomous entity, we do see a link directly to the governor. Next slide, please. And again, sorry, this slide, please. 2708. Can you go back one? Sorry. I jumped the gun. 2708 authorizes you board members to appoint an executive officer. This is at the beginning of your Practice Act and a super important decision that you need to make. And it delegates the duties to the executive officer. 2708.1, again, reiterates public protection is the highest priority in your licensing, regulatory, and enforcement functions. 2709, that establishes your quarterly meetings. So you're only meeting 4 times a year, more or less. I know you have subcommittees, but that's why you have to delegate the daily duties to your executive officer. And then 2715.c, this authorizes you to promulgate regulations. Super important. This is the conduit of how you are going to implement your Practice Act, how you're going to take action. Next slide, please. Again, 2708, you're going to appoint your executive officers, perform the duties delegated by the board, and be responsible to the board. Next slide, please. 2708.1, protection of the public is your highest priority in your licensing, your regulatory, and your disciplinary functions. And I know you know all that. Next slide, please. And 2715C, that's dear to my heart since Sam and I work on the regulations, but you're allowed to adopt, amend, or repeal regulations. Again, this is how you're going to implement your Practice Act. Next slide, please. Some other laws and regulations. There's Government Code 13324. This outlines you board members' fiscal responsibility, as does every budget act has a control section. It happens to be Control Section 32 in the current year's Budget Act, and that also outlines fiscal responsibility. And then we're also going to look at CCR, California Code of Regulations, Title 16, Division 14. That's the covers your area, the nursing board's area. Specifically 1405, we're going to look at the executive officer's authority. Next slide, please. Okay, so I don't want to alarm anybody, but Government Code 13324 does say that every person who incurs any expenditure in excess of the allotments or other provisions is liable both personally and on his official bond for the amount of the excess expenditures. Next slide, please. Every budget act says a similar thing that says the officers of the various boards are expressly forbidden to take any expenditure in excess of these appropriations. Any member of the board shall be liable both personally and on the member's official bond for the amount of the indebtedness. So I will say that it was not my intention to alarm you, but we would be remiss if we did not show you these sections. I will say that no DCA program has ever overexpended its appropriation that I'm aware of in the last 20 years. The Budget Office takes these provisions of law extremely seriously. It's why Luke and Suzanne are constantly monitoring your fund, the board's expenditures, the spending authority, the appropriation, daily, weekly, monthly, and always refining their projections. And this is why the Budget Office works so closely with board staff on a regular basis. And in addition to Luke and Suzanne, we have additional management staff constantly monitoring the expenditures of all the boards and bureaus within DCA. But let me say this, that in the event costs are unavoidable and a budget is projected to overexpend its appropriation, we do have ways of augmenting an appropriation, release valves, if you will. So we don't have to violate those provisions. You can maintain operations, but we're going to talk about more about those later. Next slide, please. CCR 1405, this is the authority of your EO. So your executive officer is authorized to A, plan, direct, supervise, and organize the work of the staff of the board, daily operations. B, research nursing practice issues and propose positions to the board based on the board's interpretation of the Practice Act. So you guys are analyzing the law. She's going to implement that. If you need additional resources, she'll go get them. C, implement regulations adopted by the board. You guys are setting the path forward. She's going to implement this. D, administer examinations, collect fees, revenues, issue licenses and permits, and investigate complaints. F, manage funds and administer the fund and budget according to board directions. Again, you guys are the admirals, she's the captain. Report to the board on implementation of board policies and responses to board activity. Next slide, please. Okay, the administration. Let's look at how the laws and regulations form the framework of the administration. Next slide, please. So the administration, the governor's office or GO, and DOF, they're all the same thing. So the Department of Finance is a cabinet member. It's one of the first offices under the governor's office. It's the chief fiscal policy advisor to the governor. It's the top level fiscal control agency, and it provides guidance, approvals, and makes recommendations. And it also implements and provides annual fiscal instructions through budget letters, as Sam laid out previously. Next slide, please. Right below the governor's office, we have in the administration, we have the Business, Consumer Services, and Housing Agency. This is the second level control agency, also providing guidance, approvals, and recommendations. The secretary is also a cabinet member appointed by the governor's office. So again, we're seeing that direct line, that through line. And then section 100 establishes DCA within agency. Next slide, please. So DCA is the third level control agency, again, providing guidance, approvals, and recommendations. But we're also providing technical support and centralized services. We're the interface and intermediary between the governor's office, DOF, agency, the legislature, and others. And then BPC 101 establishes the board along with all the other 38 boards, bureaus, and programs within DCA. Next slide, please. So DCA centralized services, what do we do? What are you paying for? So we have the director and the executive office. We have fiscal operations, that's Sam and me and Suzanne. Not only the budget office, but the accounting office, cashiering, the travel office. We have legal affairs. We have Reza and his colleagues. We have the regulations unit, your regulatory attorney, Stephen. We also have a legislative division that will analyze all of the bills going through DCA and that impact this board. We have a business services office. So if you want to buy something, if you want to contract something, you go through them. Facilities, they're keeping the lights on. Human resources, staffing, if you're going to hire or fire folks, making sure people get paid and happy. We have an Office of Information Services, IT unit, keeping your Breeze platform and your emails up and running. We have a training unit, an organizational improvement office. We have an Office of Professional Exams, which updates, as you know, you're authorized to update, you're required to update your exams periodically, and they will assist with that. And then the Division of Investigation are police officers. Next slide, please. So we're going to talk about the roles of the budget office, but just going back to that previous slide, the one thing about the budget office is we touch all of those other centralized units, plus all of the 38 boards. So we have a hand in everybody's budget. If it costs money, you have to come through us. If you want to hire staff, if you want to buy anything, if there's legislative changes, if there's enforcement, you have to go through the budget office, which is why we're so popular. This slide. So we are the point of contact with DOF. So Sam and I, we're the liaisons with DOF on all regulatory matters, fiscal regulatory matters. As Sam noted, we're going to build and implement the state's budget, monitor expenditures. You know that. Sam and I also work on fee and revenue analyses. We also help and assist with budget change proposals, executive orders, travel requests, position changes. We do legislative and regulatory fiscal analyses, any IT adjustments, and enforcement cost adjustments. We're overseeing all of the programs and all of the units within DCA. Next slide, please. Oh, and so just to harken back to the naval analogy, if this board is an aircraft carrier and DCA is the naval fleet, then the budget office really is Miramar. It really is Top Gun of the DCA. Okay. On this slide, the administration and how the BRN fits into the administration. So again, you are the stewards of this board. You're the admirals. You do have a fiduciary responsibility, which we laid out. We're going to look at some of your roles, your oversight, and then we're going to have some considerations. We're going to put some considerations for your ideas out for consideration. We're going to look at how you might prioritize and focus your efforts. Next slide, please. Okay, this Venn diagram. So on the left, we have you board members, and on the right, we've got the EO. You may have seen this in a previous training, but again, right at the top, you have the power to appoint the executive officer. You're also setting policy and you're adopting regulations, super important. You also make decisions, licensing decisions, enforcement-related decisions on your licensee population, super important. And then you're taking positions on legislation. Again, that's the long-term planning. And then in the middle, you're drafting agendas. So if you want something done, let's get it on an agenda and let's take an action. Let's talk about it. You're also setting that strategic path forward. Again, you're setting the path of this board. And then on the right, your EO, she's doing the day in and day out, the daily operation. She's representing this board. She's implementing your policy. She's taking the disciplinary actions. She's managing your budget and managing the daily operations. Next slide, please. So again, as stewards, you're admirals, you're setting this course, this direction. You're setting the priorities of this board and the strategic planning and the enforcement. Again, this ship is not turning quickly, so you are planning for tomorrow, for next year. We want you to plan from sunset to sunset. And you have direct oversight over your executive officer and your licensees and legislation, as well as the regulations, policy and enforcement. So you have your plate full with that amount of work right there. Next slide, please. So some things you might want to consider. So when you're looking at your projection document, your budget, your personal services, think about your program priorities, right? Think about your number of vacancies, which many of them were swept in this last drill. So you might need additional staff down the line. Start thinking about that. When you look at your OE&E lines, how does that impact your program? What are your enforcement costs? Think about those. What are your Division of Investigation costs or your Attorney General costs? And does it make sense? And how does it all affect the policy and operations to ensure public safety, right? That's your first mandate. Think about legislation and regulations. Think about the fiscal impacts. So every board meeting, you have a legislative presentation. So think about how those bills might impact this board and the cost to this board, how you might need additional resources. And as Sam noted, you do have a budget change proposal currently under consideration before the legislature. Public safety, always on your mind. And then on the projection reports, just typically you want to look at year over year, quarter over quarter. And if you have questions, and it seems like you guys were engaged with Luke and Suzanne, but we want you to ask questions. Every line item is open for questioning, right? And we want to make sure you fully understand every line item because again, we take your fiduciary responsibility seriously. Next slide, please. Revenues, structural balance, right? Revenues versus costs. So you guys know that your revenues are coming in more than your current expenditures. So we're trying to manage that delta. But again, this is a big ship and lots of factors, lots of ins and outs. The COVID impacted this board's licensee population, no doubt about it. So the fund balance reserve, what are your target levels? And I heard once before you asked about what is an appropriate reserve balance. There is no canned reserve balance, appropriate reserve balance. We all have a different risk aversion, right? We're all different people, but you as a body can set the amount that you want in your reserve balance. Knowing that the maximum is 24 months and that by law, BNP code 128.5 says that you need to take some action when you get over 24 months. And so we have been monitoring the fund for many years now, knowing that there's this increase in licensee population. But then we also know that there have been some legislation to maybe reduce revenues, and the board has taken some other actions to reduce revenues. Plus, what are the full impacts of COVID? Are these travelers going to leave California? We don't know yet, so we're looking at that. So lots of things to consider. Plus, the target just moved or is still in flux with the May revision with that 2.1 million for consideration of additional cuts. So we don't know what the target is yet. So we're going to be constantly monitoring that. But things to consider. Unanticipated costs, legislation, that's what you need to think about. Be on the lookout for it. And other enforcement related costs that might spike your expenditures. But think about your priorities, right? What your policy as a board should be, what the programmatic priorities and any other priorities that you may have. And then fee adjustments. If indeed we do need to make a fee adjustments, then we would work with you. And we would want to make some of the things we consider, and you have lots of registrations and license types, and you've got a vast population. But some of the things we consider is maybe trying to keep the costs lower for those entering the profession, right? And lowering the barriers to entry. Things of that nature you might want to consider. And just the overall fee structure. When you look at all of your fees, does this one make sense? Does this one make sense? What are we mandated by law? So you think about those things. And then timing and implementation. A regulatory package, despite what many might believe, should only take 12 months from the time this board approves the text. 12, maybe 16 months. But that is our timeline. That's the timeline we would set. Certainly, legislative changes take longer, and we need the cooperation of the legislature. But you want to think about the individual impacts, also professional courtesy for retired licensees, right? You're only going to grant a retired license to someone who's in good standing, right? Been a good standing contributor to your profession. So maybe you want to, as a professional courtesy, say, hey, you know, good luck and good luck in retirement, and not really charge them a high fee. But that's just something you would want to consider. Next slide, please. So priorities and focus. Again, I would focus on your appropriation. That's what DOF does, right? You can't overexpend your appropriation. DOF isn't concerned about every single line item. DOF's not concerned about what color pens the board is buying. They're concerned about the bottom line appropriation. But we also need to focus on increases and decreases now, right? Decreases. In the past, this board typically reverted $3 to $6 million. And this year we're reverting $775,000, significantly less. And that's because the appropriation was cut. Spending was more or less the same. Focus on the fiscal impacts of legislation and regulations and unanticipated costs. And if you need a BCP, then you need to work it through your executive officer and your program and think about what the resource needs are. And work that into the annual budget cycle that Sam went over. It takes time. There's only one annual budget cycle per year. So if you miss the train this year, you have to get on next year's train. And then also start thinking as far as future planning, your sunset cycle. So you're going to be going through sunset next year in 2026, sunset to sunset. That's how you should be thinking, right? Taking care of business for that entire duration. Strategic planning, that is your job as the admirals. The direction, you're setting the direction of this board, the programming and the policy direction. And then there are individual board member priorities, which only you know, right? And how you might want to implement those and bring those to the fore. So I would encourage you to do that too. And then other things, other agency costs that are beyond our control, like the Attorney General and the Office of Administrative Hearings, we have to also look at those and keep those mindful. Next slide, please. And then there are some other control agencies, and we typically don't respond to public comment, but there was a caller that talked about the NEC salaries, so I'll just address it just more broadly. So CalHR, staffing salary benefit guidelines, those are all set by employee bargaining units. I mean, I would love to give myself a raise or Sam a raise, but we are set within those ranges set by CalHR and by the bargaining units. So your NECs, unfortunately, well, the reality is that your NEC salary ranges are set by state government, and we cannot exceed those. Department of General Services, purchasing, right? You can't just go down to Target or Costco and buy stuff. We have to go through the Department of General Services. Caltech, so you have your Breeze system and our IT systems, all under the purview of Caltech. The State Controller's Office, they're handling our payroll services. So if you're all interested in any of these areas, the State Administrative Manual, you can just Google that, and that has all of the policies and procedures of state government, and we would encourage you to Google that. Next slide, please. And with that, we can take any questions or comments that you might have.
I have a quick question. So determining the upcoming year, fiscal year for budget, if there are any increases in costs of living wages for the staff, is that also factored in so they would know ahead of time if they were going to receive those or not?
Yes, thank you for the question. So for most of the bargaining units, there's a 3% increase currently built in. That is the third and final year of a 3-year bargaining agreement. It was actually penciled in for 4%, but we built in 3%. But I would note the May revision has a clause that might adjust that if the legislature so chooses.
So when you say adjust that, would they get the 4% or the 3%?
So that's all part of the negotiation process that we'll have to be looking at over the next coming weeks.
All right, thank you. Any questions or comments from board members? Board Member Allison Cormack.
Thank you so much, Chair Trujillo. Mr. Nishimine and Mr. Dyer, welcome. Thank you so much. I have served in a finance department in a prior life, and I have served on finance committees in a prior life. So this is right, Liz. I love this. Awesome. Not in any particular order, but in the order I wrote them down. So we talked about the vacancy reduction. I realize we don't actually get a list of the number of employees or the number of vacancies. I'm not asking for that. I'm just pointing out that that's not information that we have available us to help make decisions as appropriate. So kind of curious about the vacancy reduction. It sounds like they're all being eliminated. Can you just
Suzanne, do you have the details on the reduction?
Oh, musical chairs. No music.
So we are actually look at the all of the vacancies and provided them to the board, to the EO. And then we decided to they have to eliminate 50% of the vacancies. So it was eliminated 19 positions.
Okay.
Yep.
So that's been done.
Yes.
Okay. Thank you. Very helpful.
And that's
Okay. So for the coming fiscal year.
And that's when you will see it, actually, if you see the negative 2 million, 2.1 million in the projections, as well as in the fund condition, that is because of the vacancy reduction, as well as an OE&E reduction. So these are the May revised adjustments.
Where would I see the negative 2 million?
In the expenditure projection.
Oh, I see. I see.
Yep, and the fund
2135.
condition as
Okay.
well.
Gotcha. Estimated adjustments. Okay. I got it. Thanks.
Welcome.
So super helpful to have this conversation before on Friday we think about our strategic plan and walk through. And, having the forward-looking years with the budget. I just want to point out that one of the things that we're seeing, and this is on our agenda for tomorrow, day 2, item 4.0 and enforcement. Anybody who wants to come along and look at slide 10, we've been talking about in the EIIC committee, so many acronyms. Anyway, public complaints have increased over the past 4 years. Convictions and arrests have increased over the past 4 years. And those are extremely time consuming for the board and for our staff. Applicants have decreased as, expected post-COVID, et cetera. And so, I think that's really something for us to think about when we're thinking about the budget. These are more work for us, and they will be more work for the Department of Investigations and also for the Attorney General. So that's one thing that we've been seeing that I think will affect this going forward. You mentioned Breeze a few times. I don't know what my colleagues have found, but in the past week, it's been down like 5 times. It's not your department, but I'm seeing a real increase in it not being available. I don't know how often the rest of you are in it, but maybe it's just time to when our things are due. But that's going to throw a real wrench in our work if, Breeze is out this frequently. And then one thing that I think has come up, and I don't know exactly how we would focus this with the budget, but as we talk about costs increasing for our own staff, one of the other things that we're seeing is the cost to respondents of paying for their responsibility for the investigations is often now in the 5 digits. And so that's just another thing for us to be thinking about. With respect to budgets, it's not something we pay for, but as our costs increase, when someone is disciplined and is tasked or chooses to be responsible for the costs, those are increasing as well. And I've only been on the board for about 2 years, and I've seen them go up seemingly really pretty substantially. So Those are the things that I wanted to just flag for us as we think about how to work on our strategic plan in preparation for the next sunset, and how to give the right kind of direction to our EO, understanding it is not our job to steer this very large ship. So I thank you so much for coming and spending this level of detail. It will really help us when we need to make decisions about fees, which is really our responsibility and the lever that we have about managing things going forward. So those are my thoughts. I really appreciate the time of all of your team.
Thank you, Allison. Board Member Patricia Nguyen.
Yeah, thank you very much. Thank you to all the Department of Finance staff. This is all very, very helpful to go over this, occasionally. And thank you, Mr. Nishamini.
Yes.
For commenting on the public comment that we get, and we get that a lot, and it's actually a real problem. We are having a very hard time recruiting NECs to work for us. It's a very important job because we're not keeping up. And I understand that it's a Department of Personnel issue and they negotiate the salaries, but it is kind of weird that we have a surplus and we have a problem and we can't use our surplus to solve our problem. And so what is your advice to us on what we ought to do? I mean, could we pass a resolution to the powers that be to say, we've got a problem, you need to have us fix this? Or because we can't just do something as simple as a BCP, not that BCPs are simple, but, I would love just to hear your thoughts on how we might approach this.
Right. So our office, we're bean counters, right? We count the money, we do the math. That is really more of a high level policy program question that might be best solved through the legislative area or some administrative action.
Okay, thank you. I appreciated you even just mentioning that it is a very significant problem for us. It's key to the work we do, and we're having a hard time finding people to do it. And we need qualified people to do it. So thank you.
All right, any other questions? Allison Cormack?
Thank you. President Trujillo, it was a long presentation. I neglected to note that at the beginning, your comments about our EO are appreciated, acknowledged, shared. And I want to be sure that our staff gets a clip of that and provides it to EO Melby, who, works tirelessly. So thank you for acknowledging that.
And if I could just circle back to your comment about the cost recovery. So we're big fans of cost recovery. We think that bad actors should be paying their fair share. If we could look at your cost recovery rates, in the future and better align them with what the real costs are. I would just caveat that whenever you issue a fine or you issue cost recovery to a bad actor, it's unreliable revenue, right? The person may or may not pay it back. So we don't like to budget around citations, fines, or things like that.
Thank you. Yvonne?
I just wanted to provide a little additional information, Board Member Cormack, to your question. We have not lost any positions due to that position drill until July 1st. We can get you those numbers. Okay. And then we only currently have 4 NEC vacancies. We have our SNECs and our Chief of Licensing that have worked tirelessly to fill those vacancies. We actually have a recruitment process in place right now for at least one of them. But we did lose positions. And then to your point, Breeze is down after work hours for maintenance. So that could be what you're experiencing. We have not experienced it here as staff, and we have not heard an increased number of applicants and or licensees trying to use it. So Breeze is down during scheduled maintenance. So if you could let me know when you're unable to access it, that way if there is a problem, I can work with IT to resolve that issue.
Well, you can just get all my emails from Crystal because I email her every time it's down. So that's kind of interesting. So for those of us who have different work hours, we are doing our breeze work often in what is considered after work hours. So that's interesting.
And that's why I just wanted to point out that
But
that's,
that has changed. Am I the only one who's perceived that
No,
it's changed?
no, actually this week I've noticed
It's
it's been down a couple
it's
times.
like in the past couple months, it's gotten significantly worse, more obvious.
I will have a discussion with the DCA's IT
Yeah.
to see if there is anything that we can do to mitigate that.
Yeah, and feel free to ask Crystal, because like I said, poor thing, I email her every time it's down, because I'm a little bit of a just-in-time person. Just gonna acknowledge that. Thanks.
Thank you.
Thank you, Allison. Would it be possible for board members to have a copy of this PowerPoint?
Yes, we can provide it to the board.
Great, thank you.
We can get it posted on the website.
Good, thank you. Any other questions or comments from board members? Thank you for your presentation.
Thank you.
BRN moderator, can you please open us up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing it in the question box. I would like to make a comment, excuse me. Please remember, you will have 2 minutes to make your comments. I will not give a reminder as time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Bobby Dalton Roy would like to make a comment. 1 second, please.
Good afternoon, board. Bobby Roy, SEIU Local 1000, Bargaining Unit 21 Chair. I also echo the comments about Executive Officer Melby. As a former NEC themselves, they were involved and understand the concerns with filling these vacancies, where we experienced a 40% vacancy in 2023. Now you're, by my back of the envelope calculations, it's at 27% now. So a little better, but you still have 75% of the staff doing 100% of the work. I will point out that while Mr. Nishimini did mention that raises and salaries benefits can be negotiated during negotiations, there is CalHR Resources Manual 1715, policy 1715 is the employee compensation request policy. It does include an entire section on off-cycle or requests, I'm sorry, it's employee compensation requests outside normal bargaining timeframes. So there is an opportunity to do this. It would go into impact negotiations, at which time, once the proposal is set, it would come to us. We would consider it. And in my history of being with the union since 2016 and on the negotiating team, we have never denied any employer that wanted to provide a raise to our represented individuals. So I hope that, you know, that can be pursued by your urging, and that the processes are in place and there are structures in place for that to happen, so that, as noted, the cost of living increases that are occurring, the impact of the budget proposal on our employees can be mitigated with some proactive action now. Thank you so much.
Thank you for your comment. Board President Trujillo, there are no other public requests for comments on the WebEx. Do we have any in-person requests for comments there in BRNHQ?
No, it doesn't appear we have any requests for comments here in HQ.
Thank you. Would you like me to close this window?
Yes, I would. Thank you.
Thank you.
At this time, the board members will break for lunch for an hour, coming back at approximately, let's say 1:10 p.m. We will take roll call to establish our quorum and move on to the business of the meeting. Dolores Trujillo present, Vice President Neil Patel,
Patel present.
Board Member Jovita Dominguez,
Dominguez present.
Board Member Tricia Nguyen,
Win present.
Board Member David Lawler,
Lawler present.
Board Member Vicky Granowitz,
Granowitz present.
and Board Member Allison Cormack.
Cormac present.
All right, our quorum has been established. We will move on to item 7.0. This is the report of the Nurse Practice Committee, and Neelu Patel, our Vice President, will give this report.
All right, welcome back, everyone. So this nurse practice committee is generally given by Lori Melby, and it's information only. She does attend all the meetings, and I am not privy to that. I do chair the committee. Just a little refresher and reminder of what these committees are. It's the advisory committee, and we'll be providing an update that will be given by Yvonne. The committees include Nurse Practitioner Advisory Committee, Nurse Midwifery Advisory Committee, Clinical Nurse Specialist Advisory Committee, Certified Registered Nurse Anesthetist Advisory Committee, and the Nursing Education and Workforce Advisory Committee. Thank you, Yvonne, for providing the updates.
Good afternoon. So the NUAC, which again is the Nursing Education and Workforce Advisory Committee, met on March 5th. During that meeting, the following items were discussed: Senate Bill 1015 and the study that had been requested for the NUAC to complete with the recommended standards regarding how approved schools of nursing or nursing programs manage or coordinate clinical placements. They also looked at the subcommittees and how they can help. They did receive the similar presentation that we received in Agenda Item 6.1 by Nancy Spector. They discussed the ongoing data collection from the RN survey that is managed by UCSF based on our contract and how those two would not conflict. They acknowledged receipt of letters from the Quad Council and Copper Mountain College. And finally, they scheduled a stakeholder meeting in June. I believe it's currently scheduled for June 25th to review and discuss the letters from the Quad Council and Copper Mountain College in more detail. The Nurse Midwifery Advisory Committee, also known as NMAC, and the Nurse Practitioner Advisory Committee, also known as NPAC, met on March 18th. NMAC had a report out by the subcommittees about their work and requested the board staff to help facilitate some of their subcommittee meetings. They presented revisions on the BRN website to align with recent legislation and discussed the data on final disposition of disciplinary cases. NPAC discussed the updates from Senate Bill 1451. They discussed the proposed regulatory updates and frequently asked questions needed to align with that bill. Additionally, they provided an overview to the regulatory update on Section 16 CCR 1484, removing the requirements that out-of-state NPs must be licensed in California if they offer an out-of-state preceptorship to NP students. And then finally, the Certified Registered Nurse Anesthetist Advisory Committee, also known as CRNAAC, and the Certified Nurse Specialist Advisory Committee, also known as CNSAC, have not met since January, and that update was reported at the February board meeting. And that is the update.
Thank you very much, Yvonne. Do any of the board members have questions?
I have one. Okay. Yvonne stated that the NMAC subcommittee requested that the board staff help facilitate some of the subcommittee meetings. Do we know what those are?
What the tasks are that they've asked for our
Yeah.
assistance. I think just getting, connecting the two subcommittee members together, helping schedule a date, and then scheduling that meeting.
Okay, thanks.
Okay, shall we open it up to public comment?
Sure.
Okay. BRN moderator, can you open it up to public comment, please?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. And sorry, did I cut somebody off? No.
You did not.
Okay. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board Vice President Patel, there are no public requests for comments on the WebEx. Do we have any public requests for comments in person in our HQ hearing room?
Thank you, moderator. Yes, we do. We do have a comment here in HQ.
Thank you.
Good afternoon. My name is Melanie Rowe. I'm a CRNA in California and the director of the practice committee for the California Association of Nurse Anesthesiology. We appreciate the work that's being done by the CRNA Advisory Committee and thank the members of this committee as they work to make recommendations to the board on all matters relating to CRNA practice. The BRNs and executive officers' continued support of our AB 876 bill will help us advocate for our codification of our current practice here in California as it moves through the legislative process. The passage of AB 876 will greatly help CRNA Advisory Committee's work in writing regulations for the Nurse Practice Act to reflect the excellent care that CRNAs give every day here in California. Since the Advisory Committee only has 2 meetings a year, the subcommittees within are able to do the work that impact the specialty practice. We hope that the subcommittees are continued to be supported by the BRN and the executive officer. Thank you.
Thank you for that statement, Ms. Rowe. And it looks like we have one more public commenter.
Hi, my name is Susan Engel, registered nurse, and I'd like to point out that the Nursing Practice Act, the Nursing Practice Committee advises the board on matters related to nursing practice, including common nursing practice and advanced practice, et cetera. I want to bring to the board the concern about artificial intelligence and how it's impacting nursing practice, and to see if any regulations could be promulgated related to the use of the AI nurse and other issues related to artificial intelligence. So thank you.
Oh, do you mind just staying? I think a board member has a question for you.
Oh, may I just ask you a question? What would a typical problem related to AI be in nursing?
Making clinical decisions, including things related to clinical issues, documentation, hallucinations that AI have generated regarding practice. And also there's a article recently about the AI nurse. And in our regulation, nurse is qualified as a licensee that's a registered nurse or a licensed vocational nurse. So there's language in other states now that identifies that the AI nurse cannot be used and that nurses are humans, not technical.
Thank you.
Okay,
thank you.
Thank you.
Thank you very much, Ms. Engel.
Thank you.
Anybody else on the board have any questions or comments? And just as a chair of this committee, I just want to say and reiterate what Ms. Rose said, and that it's so important to have these specialty committees meet because each subject matter is so specific to that specialty that when it was one big group, I think things got lost in the waters. But now that it is, each subcommittee is represented appropriately, I feel like we're able to get a lot more done. So thank you for that. And that's all I have.
We do have one back in the WebEx. Alice Martinegra would like to make a comment. 1 second, please. Or I'm sorry, Martinegara. Alice, on your computer, there's a small window that says unmute me. It's really small. It's going to be, there you go.
Alice Montenegara, and I am making a comment on behalf of being an academician as well as a nurse. I would like to have this committee focus a little bit more on AI, as the previous commenter had made. AI is being introduced into the clinical practice so much so that And it's being used in a lot of different capacity, such as clinical decision-making, education of a patient, etc. And yes, there is a use, but there is not specific policy or language. It's being used very much so in academia and in simulation. And so I would like to see eventually to have some type of regulation that helps support or guide our scope of practice to ensure that nurses are really practicing safely in this realm with the new technology. Thank you.
Thank you for your comment. Sorry, go ahead.
That's all. Are there any other commenters?
There are no other comments on or requests for comments on the WebEx. And do you have any more in person there?
We do not.
Thank you. Would you like me to close this window?
Yes, please. Thank you.
Thank you.
Back to you, President Trujillo.
Thank you, Neil. Moving on to item 8.0, this is the report of the Education Licensing Committee, and the chair for this committee is Jovita Dominguez.
Thank you, President Trujillo. And I believe Dr. McCarthy should be elevated already.
Sorry, she is
All right.
now.
Oh, is she in the attendees?
Whoops, hold on. There she is. Sorry.
Hi, good afternoon. Mary Ann McCarthy. I am a
Thank you.
supervising nursing education consultant and liaison to the Education and Licensing Committee. Would you like me to start, Jovita?
Yes, please. Thank you.
Thank you so much. So before I officially start, I would like to bring to your attention Carrington College, which is under 8.1 on your agenda. It's bullet number 2. It is under continuing approval of the approved nursing programs. So this pre-licensure nursing program, Carrington College, was in the materials for April, but it neglected to get on the list on the actual agenda. So when all of you were reviewed the material, not all of you, but when the committee members reviewed the materials for April 17th, Carrington was in there and in all the materials, but they weren't listed on the agenda, and they have to be listed on the agenda for us to officially take action. So I just want to bring that to your attention, let you know that they are on the agenda now. It's a consent agenda item. They are, they had a continuing approval visit and came into compliance. So I just want to let you know before we start the whole, the rest of the agenda. Any questions?
I think they were.
They're still in the materials.
Yes, thank you. President Trujillo just had a question for Reza.
Oh, no problem.
Excuse me, this is Reza. Mary Ann, can I just confirm, are we doing 8.1, all the schools in it as one consent?
Yes, but I just wanted to bring, before we did all that, I just wanted to make sure I made the, I brought out the attention of Carrington, but then once you guys are ready, I was going to say all the items in 8.1 are treated as consent agenda items, unless somebody wants to pull them out, either a public member or a board member. And all the list of schools and all the motions and everything are in the agenda item summary, where we have that table that says what actually happened with each item at the ELC meeting.
So if any board members want to pull any single item under 8.1 out and discuss it separately, please speak up. And then we'll also do a check with public to before we take any action on these schools to make sure that they don't want to pull any of them out and discuss them separately. So for the members of the public, that opportunity will come.
Any board members have any questions? Pretty much laid out from April.
No.
Should we make a motion or first go to public comment? Okay. Oh, my goodness, that's too small for me to read. from here. Do you have the
Oh,
motion on
this
the?
is not the motion, so I don't know. Next slide, is it on the next slide?
Can we just move to?
Oh, there you go. I can see that better. La font is a little more, I'm able to read it. So I'd like to make a motion to accept the recommendations of the Education and Licensing Committee for all items contained in 8.1. Do I have a second?
Cormac.
I'll second it.
Oh,
Wait.
sorry, Cormac.
Yeah.
By a few seconds, millisecond. BRN moderator, may we go to public comment, please?
Before we do that, can I
Oh,
just
sorry.
clarify? Maybe Mariana, you can help me. For the school you mentioned that wasn't acted on at the ELC, Carrington, the way she phrased the motion was to adopt the ELC's recommendations. Do we need to address Carrington? Is there?
We could, because they weren't on the agenda. Again, they were in the materials and all the review. It just wasn't on the actual agenda. So legally, would it be better if we just added the recommendation, including and?
Including.
Yeah, I'd like to, what's the word, amend and add Carrington College Associate Degree in Nursing Program.
So essentially, the motion, as I understand it, is to adopt the ELC's recommendations and to approve Carrington College.
Continuing program.
Yes.
Thank you, Reza.
Sorry for getting hung up on a
No,
technicality.
I appreciate your insight, just to be, no miscommunication. BRN moderator, would you take us to public comment, please?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no, I'm sorry, there is one. Karen Fuss Summer would like to make a comment. 1 second, please. Hopefully I got that name right. Sorry, Karen. Karen, go ahead. Karen, you're unmuted, but we can't hear you. Uh-oh. Hold on. Now you're unmuted again. Hold on. Or you're muted again. Hold on. One more time. Try now. So you're unmuted on our end. If you don't have a microphone or your microphone is muted on your end, you'll have to unmute that. If you can't do that, if it's short, type your comment in the Q&A. Sorry. Or do we want to, sorry. She says, just wanted to thank you for approving Carrington College. Thank you for that comment. And Committee Chair Dominguez, there are no other public requests for comments on the WebEx. Do we have any public requests for comments in person there in BRN HQ?
None in Sacramento. Thank you.
Thank you. Would you like me to close this window?
Yes, please.
Thank you.
So I'd like to, Dominguez votes yes. President Trujillo,
Trujillo votes yes.
Vice President Nilu Patel,
Patel, yes.
and Tricia Nguyen,
Win, yes.
David Lawler,
Lawler, yes.
and Allison Cormack.
And Vicky.
Cormac, yes.
Oh, I'm so sorry, Vicky.
Granowitz, yes.
Gronowitz.
Granowitz, yes.
Thank you. Motion carries.
Okay, agenda items 8.2 and 8.3 are both information only. There is information on both of these in your packet, the NCLEX update and the licensing update. If you have any questions, we can try to answer them here, or we can have, or we can take them down and get back to you on them.
Cormac, Allison Cormac has a question.
Thank you, Chair Dominguez. I just wanted to note, since we were paying attention to the NCLEX scores, that, and there was a minor dip in the third quarter of last year, that the fourth quarter is trending back up and the average is still above 90. So paying attention to that. And then on page 132 in the licensing update, I just wanted to acknowledge really the remarkable and steady process in reducing the average processing time. It's just really consistent, and staff has not rested on their laurels, right? Even though they got it down to 2 weeks for some, they're still, continuing to reduce that. I do see that NPF, nurse practitioner furnishing, is ticking up. So perhaps if there's any information on that, we could get that. But really, it's mostly a compliment about, continued process improvement, which is noted and appreciated.
Any other members have questions? VRN moderator, would you take us to public comment, please?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Tina would like to make a comment. 1 second, please. Tina, on your phone, I believe. There you go.
Hello.
There you go. Go for it.
Okay. Hi. So my daughter did nursing, and she did 8 years of it, between being on waiting lists and going through the whole process. Anyways, the 8 years went up. She took the test twice, didn't pass it, and she's in real estate now, and I'm a nurse 32 years on the floor, a floor nurse. Just really obviously that was a hard pill to swallow. She took the test twice, and then she didn't want to take it the third time because it was just that, just that feeling of being a failure. And she's very disappointed in just what nursing is, and she wanted to be just like her mom, just being able to take care of herself. She's kind of and healthcare has changed a lot. I just think devoting all that time and energy and money to retaking the test over twice, she just couldn't want to do it the third time. So she's like, why isn't there something for these people who dedicate so much, and there's such a nursing shortage? Oh, why isn't there a place for the people that can't pass a test? Kind of like people who take the bar. They sometimes take it 8, 9, 10 times. Why are they? She seems like she was kind of thrown away from the career. And she's asking for a little bit of answers from me. And I don't know what to tell her. It's very sad.
At this time, there is no limit to how many times you can take the test.
Yes, but as
I know you said she didn't want to, but
no, it's
like
not
you
that
said,
she doesn't want
they
to,
take the
she can't-
bar.
she can't afford to because
Oh,
you
I
have to
see.
take, well, who can? You have to pay. She's in debt from 8 years of nursing school. This is reality. You know, this is total reality.
Has she reached back to her school that she went to and asked for,
Yeah, she
asked
did.
for, help and, remediation or a plan to help her be successful?
Yeah, she did that. She reached out to them. It was kind of like the door closed to her face. Like I said, that there was just no way to suffice her dedication and all the work. She's very smart. She just couldn't pass the test. It's, yeah. So
Well, if you'd like to reach out to me, I'm one of the supervising nursing education consultants, and I would be happy to, have her reach out to me and,
Oh.
talk to her about her situation. Every school in California has a nursing education consultant. We're happy to reach out to, the school and see, what kind of plan we could make to help her be successful. We hate for any students to spend the time and money and go into debt and not be successful. And the plan of every school
right.
is that their students are successful.
Oh, thank you.
So my email is mary.ann, M-A-R-Y .A-N-N .McCarthy, M-C-C-A-R-T-H-Y
Oh, wait, hold on. So, Mary.Ann.
A-N-N .McCarthy, M-C-C-A-R-T-H-Y
M-C-C.
A-R-T-H-Y.
Okay.
And it's at dca.ca.gov, G-O-V.
G-O-V as in Victor.
G-O-V, yeah, like short for government.
Oh, okay. Uh-huh. And then your name is Mary McCarthy.
Marianne. Marianne. So just have her give me an email and give me some time because we're in meetings, all week this week, but I will get back to her and we'll find out, what we can do to support her.
Oh, I so appreciate it. Thank you, Mary.
No problem. Take care.
This is Vicky. Can I make a comment?
Of course.
I just want to give a little bit of a reality check. For the DCA, there are so many boards where you have to pass a license after going to school for however long it takes you to go. And unfortunately, there are just some people that can't pass the test for whatever reasons. And it is the responsibility of the individual that got through the school and has difficulty with the test to pursue a resolution to that. And while it's lovely that there's this mother who wants to help her daughter, it also is up to the daughter to decide what she wants to do. But this is an issue in every school. I had a license as a clinical social work, and I had to pass a test after going to college to get my master's. So it's something that happens for whatever reason. So I just think that it's lovely, Marianne, you're willing to do that, but you can't be doing it for every student that has difficulty taking the test. That's all I'm saying.
Agreed. And most of them do go back to their school and the school provides services. And it sounds like that happened too. Maybe she just, yeah.
Yeah.
Thank you. Thank you, Vicky.
It's just possible that she decided to move on and mom had a dream for her daughter and is having a harder time letting go than the daughter is maybe.
Can you still hear me?
Yeah.
Oh, okay. Actually,
Actually, it's not appropriate to have a discussion. I mean, this is public comment, so.
Actually said I could speak. So if you're going to make a comment on the reason of what I displayed, then you should at least give me a chance to explain myself, because you can't make an assessment if you don't really know the situation.
Reza, can you intervene on public comment and what's appropriate and what isn't appropriate?
I think it'd be reasonable to give her an opportunity to make kind of a closing remark. I mean, we did kind of open the door to,
I was trying to make a comment about protecting staff, not about protecting the mom. So this for me was an issue about making sure that staff doesn't put out another task that they end up having to do. So, but whatever you say, it's not how I followed the open meeting laws. So
I think your comment was very reasonable and definitely a good point. But I'm assuming the commenter will make it brief and just be responsive to what was said and we can move on.
Yeah, so I've been, like I said, a nurse for 32 years, so I know what healthcare is. And she did not want to give up. She wanted to keep going forward. She couldn't afford it. She's a very smart young woman. She's not cut from, she's cut from the same cloth. So it's just okay, like the NRP test that we take every 2 years, neonatal resuscitation. We have to gear the test to where it's user friendly. We can't be so hard on these young kids who want to get into healthcare. We have a shortage. Who is going to be taking care of the world in the hospitals? We need to have a better system to where, yes, these kids go through school and then they got to take another test. So I just wanted to make a comment to go forth to say, maybe we could make it a little user friendly for these nurses so they can get on the floor to take care of these patients that aren't going to take care of themselves. Healthcare patients will not take care of themselves. We need healthcare workers.
Thank you.
Thank you. I'm sorry, Committee Chair Dominguez or Dr. McCarthy, there are no other public requests for comments on the WebEx. Do we have any in-person requests for comments there in BRNHQ?
None here.
Thank you. Would you like me to close this window?
Yes, please.
Thank you.
So it's information only. I believe it goes back to President Trujillo.
Thank you. At this time, we're going to be ending, right? Closed session. Yeah. At this time, the board will be going into closed session, item 9.0. We won't be coming back, right? Sorry, what?
Does the WebEx need to stay up or can we close everything down once we go into closed session?
So we, excuse me, this is Reza. We can close the WebEx. We're going to be recessing the public open session portion of the meeting, which will resume tomorrow morning at 9 a.m. And at this time, we'll go into closed session. So the WebEx can be shut down for members of the public. We'll be back on 9 a.m. tomorrow.
hold on 1 second. I'm going to need a link so that I can participate in closed session. It's Vicky.
Matt or Yvonne will send it to you,
Okay.
Vicky.
Yeah, we got you, Vicky.
Okay, thanks.
So yeah, just stand by for, a few minutes for us to get the team's meeting room open and get you invited into it.
I'll just call.
Otherwise, go ahead.
I want to thank everybody present for participating in our meeting today. We will start up again tomorrow morning at 9 a.m. Thank you.